All right, if I could have everybody's attention. We're going to go ahead and, we are running late. It is 1:33. We're going to go ahead and convene our workshop. This is Monday, March 3rd, 2025, Flagler County Commission Workshop. If I could have everybody stand for the pledge to the flag, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we'll take note that Commissioner Pennington is excused and is not with us for this workshop. At this time, we'll take a brief moment of silence for individual prayer, reflection, or meditation. Take this time to honor, remember our first responders and the men and women in our military who keep us safe and protect our freedoms at home and abroad. All right, thank you very much. Let's see, for today's workshop. The first we're going to start off with is a presentation from SMA Healthcare and the Health Department. And so at this time, who's going to come up first? Mr. Williams, Mr. Civitelli? Did I get that right? All right.
Call him Steve. How's everybody doing today?
Very good.
Good. Long meeting.
So far.
All right, I'll go ahead and get started. So I want to thank you all for having us here today. My name is Andrew Williams, and I serve as the Vice President of Flagler County for SMA Healthcare. I've had the privilege of being a part of our agency for 22 years, and it's an honor to speak with you today. Before we dive in, I want to take a moment to recognize and express my sincere gratitude to Flagler County for your continued partnership and your unwavering commitment to the behavioral health field. It's truly remarkable, and we deeply appreciate your support and the vital work we do together. I'm also fortunate to be surrounded by some incredible group of professionals today that are involved in the presentation. Steve, the administrator and health officer. Karen Duncan, she's the Chief Nursing Officer for SMA Healthcare. Dr. Ferguson, Medical Director of Primary Care Services. And Nicole Charbonneau, our Chief Operating Officer. And then also we have Tori Gentoli. He's our Vice President of Community Engagement. So I brought the whole dream team here today.
Very good.
Their expertise and leaderships are instrumental in advancing our shared mission. Today, I'll provide a brief update on SMA Healthcare's progress in Flagler County, including new projects and initiatives we are driving forward. I'll also share an overview of our services we currently provide, and most importantly, discuss our partnership with Flagler County Health Department. We are excited about the opportunity to be co-located and to provide primary care services within the health department, an initiative that enhances access to comprehensive care for our community. Also, I'd love to extend an open invitation for anyone interested in touring our programs. If you'd like to see our work firsthand and gain a deeper insight into our service, I'll be happy to connect and coordinate visits. So with that being said, let's get started. So SMA's role in Flagler County. So we have been providing mental health and substance use treatment services to Flagler County since 1985, so that's over 40 years, which consists of residential, outpatient, and prevention and crisis services. We currently operate out of 2 facilities in Flagler County, both located in Bunnell. That is the Access Center, which is on 103 East Moody Boulevard, and also the Vince Carter Sanctuary, located at 301 Justice Lane. So here's a snapshot of our beautiful facilities in our programs, our residential programs, our outpatient programs, and our Asset Center. As you can remember, the Asset Center, the objective was to give our citizens a place to come in regards to access to mental health and substance abuse services. So I am so happy to report that we opened our doors in 2022, The screenings completed prior to opening the doors at the Access Center from 2019 to 2021 was 164. Since we have opened the Access Center from 2022 to present, we have completed 1,311 screenings. Heidi, that is almost a 10x in terms of providing services. I wish my retirement account would do that also. We've also had 1,037 Baker Acts and Marshman Acts that we provided at the Access Center too. So I just wanted to make sure that we provide a good snapshot on the return of investment as it relates to when we opened back in 2022. So when you think of SMA Healthcare, everybody think of our women's residential program. But as you can see here, it is so much. SMA Healthcare provides services in regards to so many more different programs. So, and don't get me wrong, WARM is a wonderful program, but this is a great snapshot in regards to prevention services, outpatient services, residential services, and also crisis services. And so we provide the full continuum of care when it comes to Flagler County. So I won't go through all of these, but like I said, I wanted to give you a great snapshot of all the programs that we provide here in Flagler County. So here's our footprint in the state of Florida. So we provide services out of 6 different counties: Flagler County, Citrus County, Volusia County, Putnam, St. John's, and also Marion County. So SMA Healthcare has a large footprint in the state of Florida, and we've been operating since 1967. So needless to say, we've definitely been around. Please do not think I have an ego problem. I could not remove this picture off this presentation, but that's a sharp-looking guy. So needless to say, the services that we provided in Flagler County this year is over 2,700 clients. And so that includes outpatient, crisis services, residential, and also other services. So currently we employ about close to 70 employees here in Flagler County. With the projected projects that we have coming, that number is projected to double. So, and we'll talk about some of those projects that we're galvanizing. So here's our timeline as it relates to our services. We've been in this community for 1985, and this just shows you the growth that we've had since 1985. And so currently, these are all the new projects that we're currently galvanizing right now, or we've actually completed. And so you can clearly see that complacency has been removed from our vocabulary. And so we started in 2019, we started the Mobile Mental Health Crisis Response Team. 2022, we opened up the Access Center. 2022, we also did the Medication-Assisted Treatment Services. We was awarded a grant in 2024, the Assistant Outpatient Treatment. 2025, the reason why we're here today is we're getting ready to open up a primary care. And also, we are doing renovations at our Brown & Brown, where we're able to open up a pharmacy program right there at the Justice Lane site. So that is currently happening. As you know, our clients, they have transportation problems. So one of the things that we're bringing to the table is a solution. So we're offering a pharmacy delivery program where we'll actually deliver the medications to the actual clients. So that's something that we actually got that position posted already. So it's something that we're very proud of. And then, as you know, we are getting ready to open up the Integrated Stabilization Unit in the Men's Residential Substance Use Program. That's slated to be open in 2026. Looking at that project, we are projected to bring 69 different positions. So here's a great snapshot of our primary care program and the services that we provide. So this is a 2-minute video, so just hang tight.
The purpose of SMA Healthcare's primary care practice is to provide continuous and ongoing medical care that is affordable, accessible, and patient-centered. SMA Healthcare recognized the need for increased primary care services, not only for the clients already served in our mental health and substance use programs, but for our community at large. The primary care team consists of medical providers, nursing staff, case management, and customer support specialists. Working together, they provide healthcare services for all ages. By the use of specialty referrals, health education programs, and coordination of care, our primary care team can ensure that our clients have their ever-evolving and complex mental and medical health needs routinely met. Primary care is the foundation of health and wellness for both individuals and communities. Through preventative services and primary care, illnesses can be detected early or prevented altogether. Having accessible and readily available health care from a provider that is trusted, patients can have their medical concerns addressed in real time. The goal is to address various healthcare needs under one roof. The addition of primary care services at SMA Healthcare supports the organization's vision for our community, where all have access to healthcare services needed for hope, healing, and recovery. To make an appointment or for more information on the services available in primary care, please call 386-254-1149.
Okay. So next we have Dr. Ferguson and Karen Duncan. They will take the next slide.
Hi, can you guys hear me okay? So
You can pull that down a little bit. There you go.
Thank you. So we down at SMA in Volusia are designated by HRSA as an underserved area in Volusia County for primary care. So we are actually a FQHC lookalike, which means HRSA has approved us. We get some benefits with that. We're not fully funded, but we get some benefits. And one of the benefits is we can bring other programs into scope into our project for the FQHC lookalike. So we met with our community partners, Steve, and at the Department of Health and his team to find out what the community needs were. And we were already planning to bring primary care up to Bunnell. And he said, we need primary care. And then he said, maybe not that quickly, he said, come here. Come to our campus on Dr. Carter Boulevard. We'll give you treatment rooms. We'll give you supplies. You just come and work with us. So we went back and we talked about it. We thought, what a great idea. We're doing it in Volusia. Let's do it up here. It's great, for a collaboration with, the public health department. The clinic will serve underserved and vulnerable populations, which is the same as we do down in Volusia. It'll allow access to primary care where our providers will provide health assessments, preventative care, diagnosis, treatment. For acute and chronic diseases, we try to make it very easy for the patients to come into the clinic. We're very unique in Volusia where all of our services are on one campus. We have medication-assisted treatment, medication management for substance use and mental health disorders. Being at the Department of Health, we'll be a mile away from the other campus and we'll be a mile away from the pharmacy, so it'll make it very easy for individuals to go between both campuses for the Department of Health, primary care, and the other services. We'll work with other community partners to provide OB/GYN care because we don't do that right now. We can do first trimester care, but we work very closely with some of the local OB/GYNs that we'll still work with for our ladies. And dental services. Campus in Volusia, we have chiropractic care. We wouldn't bring that up here just yet. We do that through the school, Palmer Chiropractic. They do their clinicals on our campus 1 day a week. And it can be for anybody in the community, even employees. We do smoking cessation down there. We'd eventually bring that up here and work on marketplace options for individuals without any health insurance to get health insurance if they're eligible. Located at the health department, the address, so close, it's 1.5 miles away. One thing, SMA, primary care with the FQHC lookalike status and SMA, we don't turn away anybody for the inability to pay. Whether underinsured, uninsured, or have a copay, we have a very generous sliding scale. And if somebody comes in and they can't pay their $10 copay, say, we don't turn them away. They come in, we take care of them. We'll serve. We offer labs for anybody who can't afford to get their labs done. We offer assistance. I don't know if you've tried to get labs. You have to make an appointment now. We offer assistance with the clients to make appointments for them to get to Quest or someplace to get their labs done. And whenever possible, we try to draw the labs on campus so they don't have to make 2 trips. As Andrew mentioned, we're going to be opening up a pharmacy delivery program, and that'll be very helpful for those members in the community who have transportation issues. A lot of people walk to our clinic in Volusia, or they take the bus. Same up here. This will be very helpful, and it will help with medication compliance, disease compliance, because they're not going to go without their meds. Next slide. We employ a full-time medical case manager. This person's job is basically to bridge a gap with the patient if they need care, and especially if they need to go outside to get care. So this person sits, for example, with the client or the patient and helps them fill out the form for the marketplace, and then takes that form and faxes it to the marketplace and gets the result back if they got insurance or they didn't, and basically holds their hand. They work with them to get their lab appointments if they need it. Well, in Volusia, if it was to go get a mammo at the health department, they would help them fill that paperwork for the mammogram, get them a ride there if they need a ride there, get them back into the clinic to get the results whenever it's needed. Pretty much a great asset to the team. We partner with many of the pharmaceutical companies. A lot of times, Dr. Ferguson or the staff, there's a better med out there than the generic med, that we want to get the client on, and you can't afford it, right? Even with your health insurance. So we partner with the pharmaceutical companies to have samples on the campus for some of those high-frequency meds that we do want to have individuals on, and we give them a sample while we're going through the patient assistance process. So it could be a month of samples, it could be 2 months of samples. It usually doesn't take much longer than that to get somebody approved on patient assistance. Oh, and here we are on the last slide. So the benefits of having a collaborative relationship with the health department, more efficient resource use, data sharing to leverage each organization's expertise, enhance population health management, increase capacity to respond to emergencies, and enhance preventative care. And in a nutshell, it's a synergistic relationship between SMA and the Department of Health, because we're on the same campus to share resources, to share ideas, to share preventative measures, to share early response to emergencies. Hypothetically, we have another pandemic outbreak. The Department of Health and SMA can collaborate on that to help better send resources out to the community, whether it's a flu vaccine clinic, whether we work on initiatives when we share data on, let's hypothetically say, obesity in the community. We can put programs together where we have weight management programs, exercise programs, access to healthy diets and things like that. Are we doing all that right now? No, but that's the goal. Another idea is just looking at population health management. Looking at trying to think of like issues in the community as far as poverty, or people who have no money to buy food. So, helping those individuals working on programs to have education on to buy healthy foods, how to address poverty, how to access the other services that would be available either at the Department of Health or the primary care, and having a bi-directional open communication relationship. And for me, when I think about it, I just think of synergy. Any questions?
A lot.
I know, right?
So we have a partnership with the Flagler Free Clinic. How does the Free Clinic fall into this partnership?
So I think the free clinic, from what I understand from when I was researching the community, there are services that the free clinic we actually use for our warm ladies too. I think that would still happen. There will still be referrals at for things that the Department of Health doesn't provide, primary care doesn't provide, and we can still access those services at the free clinic. I think they have dental services as well, because I think warm is using the Department of Health and the free clinic for the dental services.
So we're all talking to each other. Okay, great. And thank you for I know it's taken us a long time to get here, and I know it's all numbers driven, and you had to wait for the money, and we had to wait for this, but Flagler County has needed these resources for a long time, so we're proud to offer them, as you are, and I hope the partnership stays together for a long time.
I hope it grows. It grows. It's going to be fabulous. Thank you for allowing us the time to present.
Absolutely, thank you.
And Andrew's offer of any tours is welcome.
Good.
Yeah, I have a brief.
Do I have time for some brief slides?
Absolutely,
Okay,
yes.
I'll be brief. I apologize.
No, you're good.
Steve Civitelli, Department of Health, Flagler County Administrator. I want to thank the commissioners for the opportunity to speak here today. I'd like to thank County Administration for all the support that I've had since being here. Thank you, SMA, having an open mind, and for my staff as well, making this happen with me as we've gone through this journey this past year and trying to revamp how we deliver services here in Flagler County. Just briefly, these are our two locations on Dr. Carter Boulevard. 206 unit is where we have our environmental health team, our community health outreach team, vital statistics, our back of the house operations. One of the big things that we really started to push since my arrival last February was outreach. We have two facilities in the county, but I really want to make it be known who we are, what our message is, and how do we get out more. So we really focused the outreach team to actually do that. We've seen recent success with going to a lot of community events, so we're very happy with that. And then our primary location where we'll be sharing with SMA is at 301 Dr. Carter Boulevard. That's primarily where our dental clinic is, in addition to our regular clinic and other operational matters. Here's our staff, just a general idea of who works here. And this is our org chart. And one thing I would like to note is that you have our leadership team there in the blue, where we have our environmental health team, our operations management team. Our senior leadership team has 129 years combined serving Flagler County amongst those handful of individuals. So there's a lot of institutional knowledge here. So I was really excited when I came over because they could provide context and help us move forward in certain areas. So really great group of folks that we work with here within the county. Just general budget items. We have a fairly diversification of our budget, state, local, federal monies all coming in. Obviously, one of my big pushes more recently is to be more efficient. And so we spend a significant amount of time trying to get our back of the house more efficient so that the front of the house projects better. Clinical services, I know Mr. Williams was talking about numbers, so we brought some numbers as well. Roughly a little over 4,000 clients served within Flagler County for the clinical operations. So we have two operations. We have our clinic, and then we have our dental. But you can see just a general listing of some of the services we provided. Roughly 12,000 or so total visits. So again, you have unique individuals of around 4,700, but they come multiple times per year, seeing different types of services. Our dental clinic, General Services over the past couple years has been renovating our dental clinic. You'll see some of the photos there. They did an amazing job. Our dental clinic is one of the most robust in the area. Saw over 4,000 clients last year. So again, I have a really good core group of folks that work with us in the dental clinic, and I actually anticipate that only becoming more efficient and seeing more folks over time. We also have a dental sealant program that operates within the Flagler County school system, and so we actually got that kicked off again this year with working with them. Our vital statistics, which was located at 206 Dr. Carter Boulevard that I mentioned. We issue birth and death certificates. Roughly 14,000 certificates were issued in 2024. So significant workload there for our staff. Women, Infant, and Children program, for those of you who may or may not be aware. So this is a program that provides food and nutrition to infants and mothers. Just to kind of provide some context of the program, we roughly issued $2 million in funds last year, which actually gets brought back into the county. So that's where people are spending these monies in the county businesses, helping those support those as well. So again, our program's fairly robust there with our WIC clinic as well. Preparedness, in a prior life, I was a deputy emergency manager, and so Jonathan and I, Director Lord, speak the same language when it comes to preparedness, and so we kind of tag team a lot on a lot of projects. We had our special needs shelters this last storm in Milton, but we also partner up with some of the special projects. This year, we're actually able to cultivate a little over $90,000 in materials for Flagler County, two of which were the scene lighting that you could see there, solar scene lighting. So if we ever need that, again, it's a state asset that we were able to purchase and bring to Flagler County. You could see Jaffe Lee in the right bottom-hand corner there. Jaffe is our preparedness coordinator. I'm sure many of you have seen Jaffe out in the community. She does an amazing job making sure that we are ready to go when it comes to storm response. Just some general flyers and wellness, talking about chronic disease. Obviously, that's something that we'd like to partner more with SMA on. Having them co-located certainly provides some context there, and we're looking forward to expanding our programs in the coming years. Epidemiology. We have 2 epidemiologists that work on at the Department of Health, and they actually monitor, I counted this morning just to make sure, it was exactly 100 infectious diseases that state of Florida recognizes. So we actually will monitor all those throughout the county. So an example would be tuberculosis, HIV, lead poisoning in children. So we're monitoring all those things and responding as needed. So just know that they're looking out for the county on a daily basis. And environmental public health. This is some of our environmental staff doing beach sampling. And so you got to get in and do it. You got to get in the water and get those beach samples. So there's a program known as Healthy Beaches. Every 2 weeks, we take samples of the waters. They get posted online so the public could see what the water quality is. And so we're monitoring that as well as several other programs when it relates to facility inspections, pools, et cetera. So that kind of just gives you a general overview of who we are. And one of the things that when we first met with SMA, I was excited because we just completed our community health needs assessment. It's a joint effort with Volusia County, and every time, it's not just in Volusia and Flagler, it's nationwide, there's always concerns about access to care and removing barriers. So when we had spoken with SMA, it seemed like a home run to have a medical home for folks where they could come in, see the health department, get their dental care done. If they had primary care concerns, they could see that, and then it creates its own internal referral process. And then as Commissioner Carney had alluded, Flagler Free Clinic is right at the top of the street. So we have all these moving pieces within a very small area, knowing that folks have transportation issues. And so I'm on the transportation board for Flagler County as well, and so that's something that comes up often. So it was really a home run for us to have everybody co-located and to hopefully expand and grow this relationship over time. So,
Can I ask you where the WIC is located? It looks like it's the same building colors, but is it in the same location?
Yes.
Just in a part of it?
Yes,
Not
it's
at
on
the
a-
front entrance, it's in the side or something
There's
like
a
that?
side wing that's, if you're looking at the building to the right, it's at 301 Dr.
I've never seen it, that's why I'm asking.
there.
Okay, thank you.
How much time do you spend on septic tank issues?
So we have a designated environmental health unit, and so they issue the permits, as you're aware. So as a percentage of that work group, we have probably 30% of what they do is septic. Obviously, more recently with the construction, it's picked up in recent years. So, so that's just the best guesstimate at this point.
Thank you.
Just a couple things. Shout out to Michelle, the nutritionist. I've known Michelle for quite a few years, and again, want to thank you for the work you do with the shelters and being out there when we have to have a shelter in need for the storms and stuff. You guys are always there, and it's a great service to have you all out there. Noticed that in certain parts of the country there's a measles outbreak. Is that something that is tracking in Florida, or what have you seen?
At this point, we have not seen any measles cases in the area, so it's something obviously the staff are mindful of. I had a discussion with our epidemiologist team recently, just kind of talking about, we have guidance from central office. I refer to it in Tallahassee. Central office has guidance that we would follow for certain outbreaks. So for right now, we're kind of going through that and making sure that we're ready to go. So that's part of that preparedness portion of it. It has to do with the shelters. It has to do with outbreaks of illness. So it's something that's obviously we're working towards.
And sorry to have to ask this, but you have had any First Amendment auditors back out?
Not in recent time, no. No, not in recent time.
I think that's all I had. I wanted to talk a little bit more about the primary care part. And I guess the other part with have you done, other than the dental, have you done any expansion in the building?
No, not at this time.
You've kind of got like 10 more things that you're doing in the same footprint as you had.
Correct, yeah. I'm big, Administrator Petito could tell you, I'm pretty into the efficiency part of it.
Well, appreciate that.
So what we did was, too, when I first arrived, we had 2 units up at 206. We renovated both of them and actually moved some of our staff up there. We found that there were several spaces that maybe weren't being used the way we could have used it. And so we shift some of our staff up there, our community outreach team, and then it freed up some space back at 301.
Okay. Well, thank you. Making the most out of what you have is a great trait.
Yeah, appreciate that.
Okay. I guess, again, on the primary care, is that's new? Tell me a little bit more about, is that started?
We hope to open up in the health department before the summer.
Okay.
Yeah.
All right. So somebody will come looking for what service will that help provide?
Well, primary care.
What's missing?
So, like chronic care management, acute care.
Okay. That's fine. I'm not a medical person, so
Yeah. So I'm like trying to figure out. Yeah.
So anything you would go to your physician for, what your annual checkups.
Okay.
6-month checkup. If it's a kid, the well visit. Meeting the milestones and things like that. We can do first trimester pregnancy, anything, toothache, sore throat, anything acute, because we're going to do point of care testing there as well. So we can test somebody for a UTI versus sending them to the lab. We can check a hemoglobin in the clinic. We can check a hemoglobin A1C. We'll do lead testing as well, just because we have to do if the kids come into the clinic. So anything you would go to your primary care for, same thing.
Okay.
Our goal, keep you out of the emergency room.
Right. Absolutely. Okay. Well, good. Thank you. Anybody else? No? All right. Well, again, appreciate everything that you're doing and for coming to present. This is very helpful to keep us up to speed on what's going on out there. So thank you very much. Welcome back anytime.
Okay, thank you.
Thank you.
Hope to see your picture out there some more, Andrew. It is. Great name.
Chair, if I could, before we go on, I just want to say thank you to SMA Healthcare and our Flagler Department of Health. They truly are a great team to work with, and there's a lot of good work, I think, that they do together to provide exceptional services to the community here. It's been much needed over the years, and I'm glad to see that it continue to grow and expand. They're a pleasure to work with and really some great community partners, so thank you both. I'm very grateful to work with them, so thank you.
All right. Well, thank you. That was a good presentation, and good to see everything that's going on. I saw lunch came in. How do we want to handle lunch break?
If you're okay with just grabbing it and eating.
All right,
while we go
Carlos.
through it?
Carlos, no more headshots. They all have to be up there. Okay.
And thank you for being here so we can present to you an update on our Flagler County Coastal Erosion and Beach Management Plan. We've worked really hard to get to this point. It's taken, for me at least, the last few years, couple of years. We've done a lot of community outreach and public engagement to get to this point. So I'm going to go ahead and get started. We've got a lot of information to go over, and hopefully we'll be able to share with you what staff has come up with as a potential solution for funding. So when we talk about being a coastal community and what those countywide benefits are, I think that there's a lot of benefit that we can experience countywide. I think as a coastal community, our county enjoys unique advantages that drive economic growth, enhancing the quality of life, and even strengthening our identity. Tourism is really the large economic driver that fuels local businesses, generates significant revenue and job opportunities. If you've listened to Amy Lukasik provide her update on tourism last year, the state of tourism, last year alone, the economic impact was about $890 million in Flagler County. We saw just under 1 million tourists into our community. When you look at what that does as far as supporting jobs, right now it's supporting right under 12,000 jobs in our community that are related to tourism. That's about 23% of our workforce. So when we look about, what does that impact, it's pretty significant. The coastal environment also fosters a high quality of life. It offers recreation, natural beauty, and a strong sense of place. I think that our coastline defines who we are as a community. I think a lot of people move here for this. So it does attract residents and visitors, and I think that an investment in coastal resiliency will ensure long-term sustainability, protecting both our economy and our way of life, not just for today, but for future generations. So I'm not going to go into a lot of detail, but just providing the brief history. We saw coastal erosion even leading up to Matthew, but I think Matthew was really the turning point in Flagler County. So we've been under an emergency declaration continuously since October of 2016. So it started with Matthew, but we've had a series of additional hurricanes and storms, as well as unnamed nor'easters and storms that have really wreaked havoc on our coastline. Not counting up until today how many times we've enacted or been under emergency declaration, but up until today's meeting, we've done it 192 times. So today on your earlier agenda, it gets updated every week, and then we bring it forward to you guys for ratification. But essentially, we've been under a state of emergency for the last 8 years, which is pretty significant. And the only clear path of exiting those emergency conditions is to really come up with a local funding strategy and to move forward with a funding ordinance. So that's really a snapshot of the history. I think that other than Reach 1, which is the section that we completed that included the Army Corps and the non-federal tapers, I think that Flagler County is more vulnerable today than we were back when Hurricane Matthew hit. So we talk about the cost of inaction and what those risks and consequences might be. And certainly doing nothing is an option. I don't necessarily recommend it because I think without having a proactive beach management, our county risks severe economic, environmental, and community consequences. Erosion will threaten tourism, which is a key revenue driver in our community. It also would diminish the public access and recreational opportunities that exist. Unchecked coastal degradation will lead to property damage, increased flooding, and weakened storm resiliency, which will put infrastructure and homes at risk. When we were looking at some of the inundation or things to expect if you ended up having a Cat 1 or a Cat 3 storm impact our coast, in addition to storm surge, and trying to figure out, what would that impact look like on our community. Even if we had a 25% loss, the value or decrease in property valuation would be somewhere around $8 million, which is significant. And it doesn't just impact county finances, it also impacts your school district, which relies on that. The school board does not have the ability to levy their own millage. It is determined by state. Although they do have some funding opportunities that they do control, but it would significantly impact the level of service provided, not just through the school, but through government. So I think that this in itself would impact, not just our community identity, quality of life. It would reduce the appeal for residents, businesses, and visitors. I think failing to invest in beach management would jeopardize our long-term sustainability and would leave us vulnerable to economic and environmental decline. So this is a graphic that you've seen before. This is really just taking a look at the Flagler County's beach management plan and what those implementation reaches are. The county, as you know, recognized the need to develop and implement a comprehensive beach plan for the entire coastline. So in 2021, the county sponsored a beach management study, which was intended to identify some beach management needs, goals, and implementation requirements. The beach management plan was adopted by this board in October of '23. We have 4 distinct beach or dune renourishment reaches, which will require restoration and management efforts. They are a little bit unique in some of their physical characteristics in regards to the beach and dune in these particular areas, as well as the level of funding that's available. So they're kind of separated out for a reason. And you may recall the green section is the Army Corps that's part of Reach 1. We did have the 2 non-federal tapers that you'll see on the other side. As we move forward with maintenance, ongoing maintenance, those tapers will become part of Reach 2, as well as picking up the piece to the south in Flagler Beach, an area where FDOT had constructed a sea cant wall as it goes into Ormond by the Sea. That area down there has not received any dune or beach renourishment as of yet, so we're going to incorporate that into Reach 2. So this is just a look at the Reach 1 phase, which was primarily the Army Corps construction project, which took place between 28th Street South to 6th Street. This project here was about 3.5 miles. It called for about $1.7 million or 1.7 million cubic yards of offshore dredged sand to be placed. This is an area that was completed last fall. It was actually right before Labor Day, I believe, and the cost was about $29 million. And then when we look at Reach 2, which is our next section, this is where we're going through permit modification and design. This is an area that will pick up the remaining pieces in Flagler Beach going north into the town of Beverly Beach, Painters Hill, and will be about 1,900 feet north of Varn Park. Right now, we are currently modifying the existing DEP and Army Corps permits to allow for a comprehensive beach and dune restoration along that entire reach. It's our hope that we're able to use some offshore sand resources for this area. This area will consist of about 1.8 million cubic yards of sand for about 5.5 miles. The estimated cost is somewhere around $35 million, and we anticipate starting that early this summer.
Do we have a plan for the easements?
We are currently working to get the easements in Reach 2. Those efforts have already started. We are working with a local title company that has already been sending out packages. I know we've actually received some of them back, I think already signed, so we are working through those efforts now.
Thank you.
You're welcome. So then as we look into Reach 3, this will be for the permitting and design of this project. Dune-only and emergency-type projects are going to be pursued in this reach until permitting challenges for Reach 3 can be determined. We are having to do some comprehensive beach and dune restoration work and really coming up with a long-term solution. This is an area where you may recall you've got hard bottom impacts, which are the rocks that are not only exposed out on the beach, but also in the water. So Reach 3 emergency projects may be crucial over the next few years as we continue to work through this. We are continued planning for call it a 3x3 or a 4x4 Army Corps study, where we are prioritizing that so that we can secure some resources for that Back Bay, excuse me, Back Bay and Shoreline Coastal Storm Risk Management Feasibility Study. And that would just be able to maximize federal participation and provide some additional funding opportunities. If we are able to do some rock mitigation in Reaches 3 or 4, we're hoping that it'll allow for us to use dredge sand, which is significantly less expensive than a truck haul. I believe when we talked about it internally, the dredge sand comes at a cost of about $25 a cubic yard, where the truck haul is about $75 a cubic yard. So it's about 3 times the amount.
Do we have any feedback or do we have any luck with the University of Florida doing their survey of the rocks? Did that pan out at all?
I haven't gotten an update on that recently. I know this is an area that we're continuing to work through. I think right now our main focus is Reach 2 and continue to put efforts here. I haven't gotten an update on that, but I can certainly check with staff.
Later's fine. Later's fine.
Okay.
I'm just curious because we started that and then I didn't hear anything about it, whether we continue or not. Thank you.
You're welcome. And then as we look at our Hurricane Milton, which is your FEMA Category B and Category G, that's your emergency protective measures as well as restoring it to its original state. Our consultant had started working on these assessments back in November. As you may recall, the board authorized that to move forward. Recently, they have provided their information on the Cat G. That information has been shared with FEMA for their review. It's somewhere around $12 million, which would require a local match of about 2. And then we have ongoing efforts for our consultant to continue working on Category B, which are those emergency protective measures. And then, as you may recall, when we were looking at the initial construction cost summary of all of the reaches combined, this would be looking at the entire 18 miles of coastline. It comes at a cost of just over $120 million, with the local share being a little bit more than the $42 million. This chart doesn't include staff time or, the labor, the efforts of our county staff, whether it be administration, the attorneys, GIS, our drone team, even TDC efforts. This is really just for the hard construction numbers. So that's what you're seeing captured here in this table. So these are the planning values for construction, not including the in-kind costs of staff. So we anticipate that we're going to have that $42.4 million local need to cover the entire coastline. So then when we look at how are we going to fund that, this is a take on where we're at with it right now. We currently have about $15 million out there in grant applications and some program funding that'll come in over the next couple years. We also have the $5 million that the board had allocated in the fiscal year 25 budget, which still leaves that shortfall remaining of $22.4 million, which is something that we need to come up with in the next 2 to 3 years. And then when we look at, following that initial construction of the beach and dune, it would be anticipated that you're going to have some ongoing future maintenance and nourishment needs. So when we're looking at this, again, these are planning values based on a 6-year project interval, which means every 6 years we would come back and do nourishment. These values are subject to change. It would follow some detailed engineering and permitting. But when we're looking at these planning assumptions and estimates, the top chart is really what's required at that 6-year mark, which would be the $97 million. The local portion would be the $72 million. And then that bottom chart shows you if we were to take that $72 million and break it up on an annual equivalent cost, what is that? It comes down to about $12 million a year that we would have to set aside so that we have in year 6 throughout this renourishment effort enough money to cover that cost. So a potential funding strategy has not yet been adopted for this estimated periodic maintenance, but it is something that staff had put together to show with you today. So when we look at the potential funding opportunities that exist over the past couple years, I know we've brought forward to the board several different options that have been evaluated. So when we look at the tourist development tax, that's something that we currently have allocated towards this effort. We also talked about doing a special assessment or tax in the way of an MSBU or an MSTU. Last year, the board did adopt the option of creating that MSBU in the unincorporated area, the northern 10-plus miles. This is something that we are not able to do on our own in the incorporated areas. It would require an interlocal agreement with those cities or towns to implement something like that. So I think that a decision on funding is going to need to be completed and adopted, though, to address the incorporated areas for consideration of a holistic approach of the entire coastline. And then there are some other sources of general revenue that we've talked about before, which would be like the local option sales tax and even using some dedicated millage. When I say dedicated millage, it's not a millage increase. We would look at our existing millage and kind of carve out an amount that would be placed into this beach management fund. I think that it is essential to preserve our natural coastline and support economic development and also maintain that quality of life for our residents. So in order to achieve those objectives, I think that we need to recognize the importance of leveraging various public funding options so that we're able to sustain and enhance our beaches. So we'll move on. I'll go through each one of these a little bit. Might have cut that out of your presentation. So this is what staff had created as really exploring the funding strategy as a path moving forward. This is to cover the initial construction cost of the $42.4 million. So I can walk you through how we got to this in support of this initiative. As I mentioned, this is just something that staff had put together. It remains subject to your formal board review, consideration, and approval. But I can walk you through what this looks like over the next 3 years. So in order to cover the shortfalls that we have, what we looked at doing was taking some of our existing half-cent sales tax that we currently receive and allocating a portion each year. You can see that in that first row where it says half-cent sales tax, starting with next year's budget and then covering it through fiscal year 28. And then, as I mentioned, the use of the TDC funds. There are 2 funds that staff had suggested using. You have 2. You have the Fund 1109, which is the capital project funding that exists in TDC. It has been used in the past to provide grants to the cities for some of their tourist-related improvements. And then the Fund 111 is what you currently have available as part of the, it's already dedicated to the beach plan. If we were to use, or maybe the thought process behind using the 1109 is that it is for construction. I wouldn't propose using it for maintenance, but I think it does make sense to use it for maybe the initial construction. It would require consideration of the TDC board as well as this board in order to change the use of the 1109 for a 3-year period. And then when we look at the dedicated millage, the 0.14 mils, that's in support of the 2 miles of public beaches that we have. There's currently 6 county-owned parks that exist on the barrier island. It's about 2 miles of the coastline. So that's the dedicated millage that I had mentioned earlier. We have potential grant opportunities that still exist. We did receive confirmation on the $4.3 million that will be coming to us. And then when we look at FDOT and their involvement, previous discussions with the district secretary, he alluded to having about $500,000 a year in his budget to be able to place some sand in front of their seawalls. So I think it makes sense to show that here. If there's an opportunity to work with them to potentially get more money, this can change a little bit. And then we also have that carryover of the current fiscal year 25 allocation of $5 million. So as you look at this, if we stick to this plan over the next 3 years, it would ensure that by year 3, we have enough money to do the construction to cover that local match that's required. Any questions on this, or? Okay, I'll go on to the next one.
I have a quick one.
Sure.
So we're able to move some funds from one, like the projects, you were saying something about your projects?
So
Yes.
Fund 1109, right now, it's part of the TDC. So TDC gets 5 pennies or 5%.
Right.
So they allocate 1 to the beach, 1 to capital projects, and then 3 go into the actual day-to-day operation of funding the tourism office. What I am proposing here would be a conversation that our board would have with the TDC board about the temporary reallocation of the capital fund to be used here for the beach over a 3-year period. And then following the construction, it would revert back to the TDC board for their discretion in awarding grants.
Okay, thank you.
You're welcome. So I figure if we're going to invest in the reconstruction of the dune and the beach, then I think we need to establish a plan to maintain it. As it exists today, Flagler County is only obligated to the area where we have jurisdictional ownership, which is the unincorporated area, those northern 10-plus miles, which is why we initially worked on that as a plan before coming together with the cities, because we can't just impose something on them. So this is on a similar approach, something that staff had come up with, exploring some potential funding to support the entire coastline for the initiative of ongoing maintenance and nourishment. It does remain subject to your board review, consideration, and approval before we could implement anything. But this is just simply one of many options. I think that it provides what I think is probably the best option, considering the use from tourists, and then inland and coastal residents who also receive various benefits. Some of them may be more direct than others, depending on how close you are to the beach or where you're located. But I can talk you through some of these various elements. This would require a supermajority of our board to enact an additional half-cent sales tax. So right now, we are the only small county in the state of Florida who does not enact the full 1%. So this essentially would require a supermajority of our board to go ahead and approve it, but this would be pledging new half-cent sales tax to this plan. We would only use the TDC Fund 111, which is what's already allocated for the beach. It reduces the amount of millage that is required, and that would only kick in the last 3 years because we're going to be levying a different amount for the construction. So we're not going to levy any more until that one is done. So that kicks in 2029. It does have a component for an MSBU. When we were putting this together, we kind of kept it flat at $160 for each parcel that exists on the barrier island. And again, this is, subject to change, but this is just something that we had, put together to show what that level of commitment should be or would look like for the people that are on the barrier island. And then there's various grant opportunities that we're going to continue to pursue. I think there's opportunities for us to work with DEP for protection of the state parks, and then continued discussions with FDOT providing funding for sand in front of their seawall. And naturally, we would continue to go after the Cat-G money that exists following any sort of federally declared storms. But I think this is a plan that we could hopefully get our arms around and support. This would give you the funding that's necessary every 6 years. This is something, though, that would require us to examine and look at every year as we develop the budget and we look at the revenues as it's coming in and what those expenditures are anticipated to be. But this would be a fund established that would cover the ongoing, not just the periodic nourishment intervals, but it would also hopefully capture the amount of money that's needed. So if we do have a declared event and there is a local match, that we have the funding available for that local match. So this would cover those intervals as well. So this would, as I mentioned, it would require a supermajority of our board in order to initiate this collection of additional half-cent sales tax. This new funding would also require what I believe would be interlocal agreements with all municipalities to be able to contribute something towards the beach management program. When we look at it, we had anticipated that Flagler County, along with the coastal communities of Flagler Beach, Marineland, Beverly Beach, they would all contribute 100% of this new half-cent sales tax to the beach. And it would also require the city of Bunnell and the city of Palm Coast to give up half of theirs. So they would pledge half of their new revenue to this plan, and they would receive the other half back to them for their own infrastructure needs. And I can kind of walk you through what that looks like on the next slide. But I think that this would allow us to complete ongoing local funding requirement of the entire 18 miles from county line to county line.
Heidi, does that take into consideration the maintenance that may be required on a year-to-year basis on the beaches?
It would, yeah.
So Heidi, if I went to Tangier Outlet and I bought $500 worth of clothes, I would be taxed at 7% as opposed to 6.5%, correct?
Currently, right now, you have state income tax of 6, and right now you have 1% sales tax right now. So you have 6 from the state, 1 from the county. The 1 that exists now from the county, half of it comes to the school board, half of it goes to us as part of our half cent. The maximum amount that we could levy locally is the 1.5. So our current sales tax is 7%. This would increase it to 7.5. So things like typical groceries that are not prepared, but things that you would go home and prepare, your medications and things like that, those are not taxed. Clothing is taxed. It would be a 0.5% increase. But the unique thing is that there's actually a cap. So like if you were buying a vehicle and say it's a $40,000 vehicle, the cap on the discretionary small county tax, it's $5,000 is the cap. So that's the highest amount that you could actually tax. So you're not getting taxed on the full 40, it's just 5, that's the max.
But if I'm going out of county to buy stuff, aren't their taxes in St. John's and Volusia slightly higher than ours?
Well, when I started looking at the comparison to some of the other counties, and I looked at Central Florida and I looked at Northeast Florida, and what we're seeing is it's 7.5% in Duval, Clay, Alachua, and Osceola. Orange, St. John's, and Volusia are currently 6.5.
Oh, it's less, okay.
Yeah, it just changed in January.
The important thing to remember is the evolution of these sales taxes and fees is becoming development-centric. Daytona 1 has an additional, and I think Town Center as well up in Jacksonville have additional fees that go on your receipt that you don't even know when you're just walking into the place. But for that movie ticket at Daytona 1, there's I don't know what it is, but another $1 or something service charge sales tax that goes on. Those are hidden. They're not even, you can't even find them unless you know where to look. But that's becoming harder to gauge between counties.
It is, because it's really not encompassing when you're looking at when you're trying to compare apples to apples, they're all set up differently. So some communities have CRAs or CDDs where they have different taxing districts that incorporate some of that. You'll even see in some areas where you have tourism improvement districts, and those also play into some of those fees that you'll see on the receipt. So it's not, and I know it is something that we had talked about coming back to the board, and we planned on doing it, I think, in April or May, is having our budget team present back to the board on the uniqueness, I guess, of every community and how they leverage their funding. We don't have a good mix of general revenue. We rely heavily on millage, where you have other communities that kind of balance that revenue stream, where they have MSBUs, MSTUs, different types of assessments or other tools that they use that we don't currently have. So it's not, you can't look at it, I guess, as just a clear one-to-one, because the makeup is all different.
Well, this spreads it out, so not the average homeowner, and I said it at the Flagler Beach meeting, and I was quoted, that no one wants to pay this $160. Let's just face it, no one in this world wants to pay it. So if it rises to the level of a high priority on the Flagler County Board of County Commissioners, I'm sure that we would take whatever options that were available to us to make that not have to happen. It's just, it's a possibility. Personally, Fund 1109, if the tourism could live with it a few more years, that would be I mean, we are very generous, the county's very generous, and I know we give out lots and lots of grants. We gave Flagler Beach $775,000 this year. I know there's all there's resolutions on how you can spend that money, but if it's a dire need or a top priority in our county, then we may have to use it. I mean, we should never close the door on anything that we have access to. I did a little bit of research on how I mean, it's not like we don't have a bunch of counties in Florida using or getting Army Corps projects. They all fund it differently. We just have to find what fits in Flagler County. But they all have to fund it. They all have projects, and we just got to figure out a way to do it. That's, I think, has been the struggle here, is getting to, and again, on a yearly basis, we're going to look at this, and we can make adjustments, correct? I mean, it's not like this is carved in stone. It's not forever. We just need to kick something off so that we can get started.
We would look at it annually as we prepare the budget. This would be one of those items because the amount that you would charge in that assessment, if we were to enact the MSBU, that would be something that we would adjust annually. We don't anticipate that it would be more than the 160, but again, there's always room for improvement. The thought with the 1109, and this is just internally talking to staff, is that you wouldn't want to put all of your eggs in one basket. And so what the 1109 fund does is it allows them the opportunity to continue to enhance and improve your recreational facilities or facilities that will draw tourists into the community. And that's why, we only looked at doing it through the initial construction because it makes sense, not the ongoing maintenance, because I think if we're going to build it, we need to come up with a plan to maintain it and not tap into money that should have been allocated to other improvements. But initial construction, I think it does make sense, but certainly this board will have an opportunity to talk to the TDC board, and if it's whatever the pleasure of the board is. I know in going out and talking to some of the other communities, I know that there had been maybe a little bit of, I don't want to even call it pushback, but a discussion about should it be a flat fee? We've looked at a variety of different things, whether we do a small base rate and then the other piece is maybe tied to the value of the property that you're protecting. And that's certainly something that we could look at if that's the pleasure of the board. I just think that there's opportunities to further define this based on the guidance that we receive from our board.
Well, I think the end result is what that total amount for the 160 is. So we really don't care how Flagler Beach raises that amount. They have the option of doing the MSBU and spreading it amongst 160, but as long as they came up with a plan to raise the same amount of money, whether they split that in half and did some other funding mechanism, right? We don't care.
We don't care how
Gives
they're,
them flexibility, the municipality.
yeah, we don't care how they're going to come up with it. I think we actually shared that in Flagler Beach, that if they took the amount that would have been captured, I think it was somewhere like around, say, 550,000 annually. If they wanted to implement paid parking and they wanted to pay for it out of paid parking, they certainly could cover that, so then their constituents aren't having to pay it. But maybe in the unincorporated area, we would enact that MSBU. So at the end of the day, we just need to make sure that that amount of money is captured so that in those periodic intervals, we have the funding in place. So if you'd like, I can move on to the next slide and I can walk you through the equitable sales tax distribution. So this would be a look at the new half-cent sales tax. As I mentioned, the county and the coastal communities would be pledging 100%. But as you can see in fiscal year 26, if this were to go through, the city of Bunnell would contribute about $107,000 to the beach, and they would receive back about $107,000 for infrastructure improvements. Palm Coast would contribute about $2.7 million, and then they would receive back about $2.7 million for infrastructure projects. The good thing about sales tax, and talking with Amy, it's estimated that tourists contribute about 30% of the sales tax revenue in Flagler County. So when you look at the use of the TDC funds, which is 100% tourist-driven, and then you add 30% of the sales tax also being attributed to tourism, I think that you see a good balance there. I don't know where you can go and have somebody pay 30% of your bill, but we can with tourism. So I think that it makes it so that it's equitable, not just based on the tourism component. They are a huge economic engine. But I do think people, whether you're inland or on the barrier island, it has people paying. I think it's an equitable share. And then we kind of just outlined what those next steps or that timeline was going to be. I mentioned it earlier. This actually kicked off a couple weeks ago. It ends today. We've got this meeting, and then we've got one tonight in Beverly Beach. And then hopefully when you guys convene in March on the 12th, when we continue the joint county-city workshop, we'll have I think a healthier discussion about this plan. We're looking at staff level, finalizing some sort of level of commitment April, May, because it's really going to impact our budget. So we need to know what direction we're going to be going as a community. And then depending on that level of commitment, whether we move forward just in the unincorporated area, which I'm hopeful that's not the case. I'm hoping that we can do the entire countywide plan. But if we were, it would require creation and adoption of interlocal agreements to transfer beach responsibility over to the county so that we can go after funding. It would also require the interlocals for the equitable distribution of that new sales tax so that we can ensure that we have that new funding allocated. And then if we were to do the MSBU with the coastal communities, it would require some further work there. And then we have more next steps, which would just be to continue discussions with FDOT and FDEP, and then finalizing our budget, which will be August, September timeframe. If we were to do an MSBU with those other municipalities, it would bring us to the end of the year. And then this is just kind of the additional updates that we would have to do.
Mr. Chair.
Yes, ma'am.
Okay. I'm trying to digest all these big figures and numbers, and so is the public. Everybody who's a homeowner here is wondering if their taxes are going to go higher as far as their home taxes. A lot of people here are renters. We have a lot of rental communities coming up. They're users of the grocery stores where that tax would be collected. Guests who come to town, families, holidays, things like that. Those are all people that are going to contribute. I think it's much less painful to share it with the users rather than just the homeowners. The average new homeowner is paying for an entry-level home. When they get their tax bill after it's been agricultural, they are awakened to a rash reality that it's expensive to live here, not cheap like they thought. So I think they're very concerned about that side of it. I hear it every day in the field I'm in. So I think, a half a cent is nothing, especially since they're getting away from pennies. So I guess we can cut our pennies in half and then make it worth more. Somebody said it takes 3 cents to make a penny. So maybe we can triple that value. So here's my suggestion to our staff and our people out there is to heavily market the benefit of that half a cent and what it saves you personally. Because if it's a half a cent and you buy a pair of sneakers, that is $102, which shocks me to no end. How much is that half a cent? A nickel? You can't even buy a piece of candy. They need to see a chart. They need to see it, how it affects them. Everybody doesn't understand what's happening until it affects them. So to preempt it would make it very easy for us to make it comfortable for all of our residents, all of our guests. We're not going to, visitors. I think we have to do a very big promotion on it in a positive and turn it into a positive instead of everybody saying, oh, there they go raising taxes again. It's a catch. It's a catch-22. But I think we can prevent that and not have this anger or frustration with the cost of taxes, because people are on the edge. They're really on the edge financially. And we want to make sure to protect our public, to not feel like they're being taken advantage of. And that's why they need the education. And it's an example here, because here we are at a workshop when people are not here, and they have the world has no idea, except for Greg. Greg gets first picks because he's been here a lot, and then we've got Ron. So when you take those two, they can't fix everybody, and that's our job, is to make sure we publicly explain to them how it happens. That's my opinion. I hope I'm not wrong, but a nice big chart, all these beautiful charts and all these things we do. Boy, a big chart on what, how much is Clorox?
So Pam, being the salesman like I am, what you do is you reduce it to the ridiculous.
Reduce to ridiculous.
And
yes,
that's an old sales slogan, or whatever you want to
Absolutely.
call it.
Yep.
So you take a grocery bill or a clothing bill or something.
A box
And,
of cereal.
you know, we all go shopping every week, and you show the impact of that half cent
It works.
to the guy who goes into the liquor store and buys a case of beer. I mean, it's a way of reducing it and having people be able to look at you and say, oh, well, I never thought of it that way.
Of course.
And I do agree with Pam to the point that if we were going to referendum on this, right now it does not look like our staff is suggesting a referendum. We don't have time for a referendum, number one. Number two, it doesn't look like they're recommending that. If we were going to a referendum, you can talk to the school board expert on how to sell a half-cent sales tax, right, Andy? They got it nailed, don't they?
It's different, but there is a process
Right.
in doing a referendum, for sure. And we've had the same discussions about how to make those same types of applications in this, so.
But I think that's why our staff has gone to the elected official level in their presentation, is because we're not going to have time for a referendum on this. It's going to either be a a majority here
Supermajority.
and a supermajority here with, do they have to do a supermajority on the interlocal and all that stuff? They just have to have a 3-2.
They would just need a majority on the interlocal agreements at
Right.
the city or town level.
Right. So they're waiting to find out what our direction is going to be to our staff.
And I know that the chair and I have talked about this before in some of our meetings, and I don't disagree that I think you handle it as if you are doing a referendum where you do have a campaign. Internally, we have a name of what the campaign would be, and we recognize the fact that, the objectives are to, excuse me, educate the community and then, build support and also demonstrate that value of what that is. And I think at the end of the day, it's really going to revolve around some core messaging about not just sustaining our economy, but protecting property and community. I think that it's a fair and balanced contribution. I think minimal impact on residents, that, although it is a small increase in sales tax, I think that it makes a big impact in the way of beach preservation for our community. And I think, telling the story that the visitors, the tourists that come here are helping fund it, and I think that if it is the direction of the board, we can move forward with a campaign and start that. We didn't want to get ahead of you, and so, we wanted to give this presentation to you today and kind of get your feedback.
Well, it sort of sounds like you've got the same mindset I've been thinking, and I'm excited about that because I think that's the only saleability we have on resolving this huge issue that has been going on, and we need to get it to the end. And I think that's the only way the public is going to be supportive of our efforts, honestly. Thank you.
And I will add on, some of the discussion you've had, the state dictates a lot of this stuff. So for the school district, they have to go through the referendum. They don't have the choice. They've given counties the choice. You can do A or B. And if you do the referendum, you can bond it. We don't have the need to bond because it's pretty much a pay-as-you-go. We're saving the money to the point where we need it, so we're paying as we go. And I think that was one of the clarifying things in my head too. Was the is that we don't need a bunch of money up front to build something. Say, you know, we're doing it incrementally. We're paying as we go, and I think that's a big part of the message as well. Yeah. But it is a process to go through. My discussions, especially this past Saturday, was a lot of, and I know there's others still. There's counterbalancing the negativity with the positive. There's a lot of people that are saying thank you for doing the heavy lifting. That, you know, this is something that needs to be done, and you know somebody's got to do it. And it's been a lot of work. Heidi and Jorge have put months and months of work into analysis of trying to figure out the fair and equitable as close as you can. There's flexibility built into it for the other municipalities. So it's, and still educating people, I find, on the difference between the emergency dunes and the nourishment. Unfortunately, people have in their heads the vision of the emergency dunes washing away with and just thinking that all sand is just gone, and it's not. So we're still in the mindset of having to explain what a renourished beach is as opposed to the emergency dune placement, and how over the course of I think Ansley had said three successive renourishments builds that outside shelf, which is part of the protection that's missing. So a lot of things that we can use to help. I think it was the TDC discussions will be important. I mean, and going back, we're in a kind of a catch-22. If you go back to August, when we did the initial presentation with the consultant who had the surveys and all that other stuff, the backlash was immediate. It was as though we were forcing this plan down on everybody, and all the municipalities were, from Flagler Beach to Palm Coast, was the immediate pushback. So, right, how do you treat this now then? What do you do? So part of it was coming up with a plan or an approach to where we would, starting with the last joint meeting with the municipalities, is not forcing something on them, but asking, what are the problems? So we asked the question, we have a plan for ourselves, but we also have a plan for the rest of us if you want to be a part of it. And we got feedback from them on what they didn't like about it or what we thought was going to be problematic. And then we were able to fine-tune the presentation and bring it to them. So the pushback is, right, City of Palm Coast says, well, the county needs to do it first. But the problem is when we do it first and we present it to them, it's looking like we're forcing it on them. So you have to balance the feedback versus being too forceful. And the second attempt was asking for feedback instead of being forceful. So eventually this will come to us, but we need to know if we've got dancing partners.
The feedback that I get over in my district over there is this plan kind of solves it, because they say $160 a year. Come on, that's not a problem. But I got a problem with Palm Coast not paying a penny. And this plan solves that. We can show that everybody's kicking in on this, and that solves that problem. And then the other feedback I get over there is, well, I don't go to the beach. I don't want to pay $160 a year because I don't go to the beach. Well, that person, we have to constantly remind them that this is not just a beach thing. This is a protect the property, protect the Outer Banks, if you will, the outer islands. So we've got a good story to tell for
Well,
any
the other
type of
story
deal.
is, if you look at the total 18 miles, right? Originally, it was only Flagler Beach that had a zero cost I mean, there's not one taxpayer in Flagler Beach that spent one dime on the Army Corps project.
Right. It's true.
It all came to the county to manage it, to sponsor it. We were never asked to put up any money for that project. Now you're going to Reach 2, which is Flagler Beach again, and they have not paid 1 cent. The municipality, the people, have not paid 1 cent for that project. You go up to pay, as we move north, nobody's paying for it except the county, right? The state, the county, and the feds. That's the way construction.
No, the communities up there have paid a lot of money. Hammock Dunes is
For emergency.
millions and millions of dollars, and so is Ocean Hammock,
Correct.
paid millions.
But for the construction, to get the project done, it's all going to be covered. So this is a holistic approach to 18 miles with, unfortunately, you're right, Hammock, having to put in some emergency funding for an emergency dune. This will give them the dune they need long-term.
Right.
And then the whole community participates in the, listen, we're going to call a spade here. Something's going to hit Flagler Beach. Something's going to hit, right? And that Army Corps is going to have to come back. Well, that money that we had appropriated towards that, whatever it is at the time, maybe it's 3 years, maybe it's 6 years, that money will be free money. So we can then turn that into, right? We can move it out. We can keep it. Huh?
There's no free money.
Oh, no free money, I'm
It's all
sorry.
free money.
Well, all right, but it's money that we didn't have to use to rebuild it because the Army Corps rebuilt it. And that was the whole idea on that critically eroded beach, was to let the Army Corps come in and help us. And they're going to do it. And as we move north, hopefully things will get better for us.
So with those accountable funds, you're speaking about. So here's the question. So we put this into effect. We're done by 2028 or 29 with the renourishment, right? Approximately, right, roughly. We'll say, try to say 29. So by 2030, will this be sunsetting this sales tax?
No,
It will never sunset.
no.
they-
You're
It
gonna
will
have
be
those
permanent.
future
Okay, that's what I'm asking.
They have
if-
increments, so they all have to be renewed at some point. So
Right,
this
at
one
the
would
end
be
of its
a
term.
20-year term.
Okay, I'm just, so there's a possibility it could in the future.
Well,
Long future.
We have to keep amassing money so
To
that
keep
every 6 years, we've got enough money. You know, some of the bigger counties, I mean, they laugh at me when I say, how did you guys do it? And they say, oh, we just write a check. And I said, where do you get the money? And some of the bigger counties just say, it's all TDC money.
All TDC.
It's all TDC money because
That's
they
what
get
my
it.
research showed, the same thing.
Yeah.
Yep.
They get more in a month than we get in 2 or 3 years.
But they're big cities, and
Oh, yeah.
they're established long-term.
Yeah,
And
but-
this county has just begun growing since I got here.
Yeah.
3 lights to Daytona.
You've heard me tell the story. I'd
That's
sit
all
there
I
and
know.
listen to a guy give a presentation and say the only county in Florida, Beach County, that doesn't have a plan is Flagler Beach. And that was, I just put a hand over my name tag. You know.
That's the requirement. I guess that's a requirement at this point,
And
so.
Pam, I think your timeline's a little off because, right, we have to, the first 3 years are accumulating money for construction.
Right.
And then.
Then we need to build up
and-
the-
And then the 6 years has
bank.
already started on
Right,
Reach 1.
Right, I'm saying we got to build up the bank, but
But-
that's why I was wondering if it ever sunsetted. That's my concern. Never. Okay. That's,
Well, it has to be renewed.
okay.
Has a 20-year limit. It will have to be renewed in 20 years.
Okay.
Nothing lives on,
It for eternity.
right.
And by
And
then, we
if-
should have a good feel.
And based on Ansley's calculations, you get 3 renourishments. So those 20 years are going to be needed. So every,
Yeah, I'm not questioning
so you're
that it
looking at-
shouldn't be. I'm just wondering if it ever reverts. And that would be no.
it'll come back
Not
to,
necessarily.
it'll come back to the commission at 20 years.
I'll be in a nursing home. Okay.
So Dale Martin, Flagler Beach city manager, his county that he was in, which is up near
He's Fernandina, he's
Bernardino.
Nassau County.
Nassau.
100% was ad valorem, and they adjusted it as needed. In some years, they hit them up with a big ad
Yeah.
valorem, like 1.5%, 1.5 or 0.15. It's 100% ad valorem. So again, the only people paying for it are the people that own the houses. It's not
That's
fair.
not right.
All right.
So do we have consensus from the board then to move forward with a campaign?
Yeah. Well, I think the biggest campaign is Palm Coast, willingness to give up half the half-cent sales tax, and Bunnell, same thing.
Yeah, I think the
I think
campaign
that's one of the
is
biggest
just
things.
getting to an agreement on the interlocal, right? It's really comes down
Right.
to the agreement with the interlocal. I think once everybody's in agreement, I think a campaign to promote it is what would follow.
So we understand that if Palm Coast is a flat-out no, we can't move forward with ours.
Correct. It's almost a
So they know that. It's not like they don't know it.
We've presented to everybody other than
Correct.
Beverly Beach. So I think that they all understand what's going to be asked of them. But what I was looking for is not necessarily the campaign to go after these interlocals, because you're going to have a joint meeting on the 12th,
Okay.
but is starting to develop the campaign, the public campaign of going out and doing the education, building support, and, all that messaging.
like a Dodge the Dunes thing.
Pretty much like a Dodge the Dune thing, but like working it as if you were going to a referendum. But I don't know if I would wait to see what they're going to decide. I think that a lot of these things, you need to get out ahead of it. And so if you're going to meet and convene in March 12th to talk about it, they may or may not have made a decision, so we might not hear from them until April or May. I'm just saying, I don't think it would be prudent to wait until April or May to kick off a campaign on something that we're going to be continuing to discuss. So I'm
Okay.
thinking, like, building up the momentum now, and if you direct me and staff to move forward with the campaign, just real quick, we have a name: protect our beaches, strengthen our future. We can start working on those key objectives, core messaging, and kind of, hit it now and ahead of whatever decisions they make.
Do you think that would sway Palm Coast at all to see that we got involved in the actual educating and bringing it forward?
I don't know.
Can't say, but
Yeah, I
I think
can't
it's
say.
important. I think it's
I think it's a good
a
step.
good step.
Yeah. I think we got to do it, Heidi. I think,
So do we have consensus from the board to
Yes,
have
ma'am.
staff move forward?
yes, ma'am.
Yes.
All right, thank you.
So we only have one member that's not here, and this is a workshop, so we're not physically voting. But you feel comfortable with the communication?
From the board? I only look for consensus. It doesn't have to be the it doesn't have to be all of you unanimous.
Well,
If-
it will be when you ask us for the vote on the half cent.
Yeah.
You need
That'll-
4 votes.
That'll be an agenda item.
That'll be an agenda item.
But you
This-
feel comfortable with what we've asked you and how we're,
If the 4 of you are telling me that you're good with us starting a campaign effort, and you're all shaking your head and saying yes,
okay,
then I'm fine with it.
okay.
I always go back and look at the minutes to make sure that I had consensus, which I always do before I move forward, so.
And that would be focused towards the municipalities, but it'll also be
Countywide.
focused for the residents and,
Correct.
the community.
Correct. So
I know
we-
we're not voting, but Commissioner Hanson, you're on board with consensus,
Entirely.
and Commissioner Carney
100%.
and Commissioner Richardson just acknowledge something in the microphone,
Yes.
and I am too, so.
Well, thank you.
We had an issue about that once before, so it helps to be very clear.
Learn to shut me off as soon as I'm done.
Well, thank you. I don't have anything else related to this. We'll get going on that campaign.
We're passing the baton. All right, next item on the workshop agenda is budget. Brian, welcome.
Brian Egginger, Financial Services. I just have a brief 4-hour presentation. You guys
Thank you.
So today's agenda, we'll talk about roles in the budget process. We'll look at timelines and some budgetary framework. There's a lot of information on these slides. You guys have copies of it. The public has copies of it. I'm not going to sit here and read it to you. We'll hit some major highlights. If there's something you want to talk about more in depth, we can. All right, so first up is Board of County Commissioners. You guys are the policy making, I broke it. Yeah.
We handle all IT issues.
There we go. So the BOCC, the policy making group, and that's the biggest, most important part of this entire slide. Policy making, you guys are big picture. You're thinking strategic plan, long-term success of the county, things you're hearing in the community about what the community needs. The other part being group. So it's not just, one person's decision on how we make the budget. You guys can bring things forward, you have discussion, you come to the administrator with a united front about what you want to see. You guys are setting priorities, guidelines, and what steps you want to see in your budget. And this was primarily happening in December and January. You guys had a workshop. You guys are having one-on-ones with the administrator, talking those things out. And then at the workshop in February, you guys kind of set this is what we agreed to in our discussions with the administrator. So next is the county administrator. Acting as the budget officer, and we'll get into that a little bit, the county administrator takes all those things that you guys were discussing and then basically forwards that out to the staff, the department heads, and the constitutional officers on how they should make their budgets to give you what you guys wanted. The budget officer is defined in Chapter 129, Florida statute, and one part that I thought was interesting for your knowledge is even if you didn't designate the county administrator to be the budget officer, it doesn't go to the chair. The default is the clerk of the court. So thinking about the way that the legislature purposely structured that, sweating bullets. The legislature purposely structured it that way that it's not the board. You guys are not, by default, the person that would do budget officer duties. You're policymakers. The county administrator reviews every single line item for expenditures and revenue. The county administrator also will present to you the tentative budget. It's a balanced budget. It's trying to meet all the things that you guys want, all the things the department heads are telling Heidi that they need. It's trying to be financially responsible. It's making sure that those things all line up to the strategic plan. Department heads. So these are your experts. They are specific in the fields that they work in. They are the actual people doing the budget entry on what they need for the upcoming year. They provide specifics. We require line item detail for everything. You don't get to just say, we need things and stuff. We want to see, you have a plan for mulch, you are buying lumber. Everything is line item detailed. When a department, and I do a couple of budgets myself personally, so when I'm developing a budget for the next year, I'm looking at year-to-date spend reports. So we send those out to the department heads each month, so they can use that to see where we're at. Some things are more seasonal expenditures, so year-to-date might not necessarily help them in that moment, but we have historical reports that show what we spent over the previous years. They're also looking at possibly getting quotes from vendors for something that they might be looking to do in the next year. And any additional personnel, new programs they're trying to start up in their departments, they fill out a decision unit form, and those forms get compiled and are reviewed by the administrator. So it's not like they just go in and put in new stuff that they want. It goes through a review process to make sure that we're not just throwing things in without thinking about it.
I'm sorry, Brian, that's a new term for me, decision unit. Could you help me with that?
Gotcha. So kind of what the name implies, decision. So it's not just an automatic. So things that we'll talk about sometimes you'll hear, especially John giving presentations, hold harmless. You have a contract, it's got a CPI adjustment. There's no way out of increasing the budget for those type of things. Decision unit is there's a decision to be made. We don't necessarily have to do it, and there are alternatives or justifications for doing it. And ultimately, Heidi's going to make that decision on whether we're willing to spend X amount of dollars to add that program or add that staff member. Office of Management budget, clearly the most important part of the budget,
That's you.
Exactly. So we're going to be analyzing budgets. That's the biggest synopsis of what we do. We're looking at, do the historical trends make sense? If you're looking at a $10,000 increase in a budget line item that you've never spent anything on, we're going to see that. We're going to question it. We want to get to the detail of why a department head thought they needed that type of increase in a line. We're going to check to make sure that. Oh, sorry.
Do you look at, I've done a lot of these in the Navy. So occasionally you have to look at what they did last year and make them justify that too, because you'll see something that was only a year-long project and they try to get the money again.
Yeah.
And
So
it's not really,
That's
No.
You're stealing my thunder. One of the things we go and we look at is making sure we scrub the budgets for one-time expenditures. So you get a one-time thing. It's a one and done. Don't let me catch in your budget because we're going to find it and we're going to pull it out. So we're definitely always reviewing for those type of things.
thank you.
In reviewing the budgets and mills, we're also making sure that a decision unit didn't accidentally get entered by a department. Sometimes these things happen. We make sure we pull them out and we give them to Heidi to, again, make that decision. The OMB team also enters all personnel costs. So a department can't sneak a new position in. They can't, add $10,000 of overtime. We make sure that all that goes in. If there's any increases, right now we don't know what the cost of living adjustment's going to be. As we get more information, we'll come back to you and say, here's what we're doing. If there's increases for health insurance, FRS rates, the things we always go over every year. All right, so this is the timeline that we talked about. So in December, January, that's the BOCC's time. Tell us what you want. Then we go into February. The county administrators holding kickoff meetings with the department heads and the constitutionals, relaying that information to what you guys just said you wanted. Then we get into March. This is where the department heads are entering their budgets into the system. And if they have any decision units, they're filling out those forms and sending it to my department. Then my team starts working. We're reviewing budgets. We're having meetings with Heidi. We are going to meet with every department, go over every single budget, over every line item. She's asking questions. Heidi's big on historical trends. We'll constantly be pulling up, what they spend in that line this year, what are they forecasting to do for the rest of the year. Then we'll head into June. June is when we start to have our series of workshops every Monday. You'll get tired of seeing us. And that's your first opportunity to look at the budgets that are being made, suggestions, input, that type of thing. July, you'll get the tentative budget presented to you. Again, it's a balanced budget, trying to incorporate what you wanted, what the department said they needed, and being fiscally responsible. August, you guys, I think we have 2 budget workshops tentatively scheduled in August. If you guys want to meet to discuss, make changes, we can. If you guys are happy with what you've gotten, we don't have to talk. And then hopefully September, smooth sailing in the first and second public hearings to adopt the budget. And hopefully by then, and Commissioner Dance saves us all the time, if you have things that you want, say it early, get consensus. September's not the time we want to hear those things. You have the ability to do it, but we really love it when you don't. And then, so now we'll talk about the framework. The good news is a lot of this is review of things that we already did because we're doing them, so that's good. The board is giving county administrator policy, guidance. She's going to use that to make your budget. She requires the departments to provide justification. I don't get to just go up to Heidi and say, I'd like a new budget software today. And she says, go for it. Why do I need more budget software? Is it possible that I could downsize my staff and save some money that way? Those are the type of questions that need to be asked and answered when we're asking to spend taxpayers' money on something new. Heidi's making sure that things align with the strategic plan. We talk about that as being a very important guiding document. If we're deciding to spend money on something, it should relate to the strategic plan. And we talk about identifying non-essential spending that can be reduced or deferred. Do we have to do it? And sometimes, do we want to do it? Do we have to do it? Wants and needs. Those are the conversations that have to be had sometimes. Department heads, I want to focus on the identify any new policies, state mandates, or financial constraints affecting their department. Sometimes there are things that are outside of our control. When we came out of COVID and we started doing construction projects again, cost of lumber through the roof, can't get contractors, still can't. Bless you. Things like that are always pulling us in different directions, and we have to come up with ways to handle those. Current operations, staffing levels, and service demands. What we're doing, does it still make sense to be doing it? Just because we've always done it doesn't mean we keep doing it. Maybe there's a more effective way of doing it. Maybe we don't need to be doing that program anymore. Those are things that we're hoping that the department head sees and can change or bring up to Heidi to then present to you if that's a thing we want to entertain. They're considering growth. Waiting until growth shows up is not ideal. We need to plan for it. And sometimes that is a change to, I don't think we're this far, but say a VOTRAN system that we have down in Volusia County as compared to what we have here. We're not ready for a fixed route, but there's a possibility at some point we are ready for a fixed route. And then want to point out the interdepartmental collaboration, really big, especially since Heidi's been in charge. We have discussions where there are sometimes economies of scale, just thinking it from a different angle. If we're doing a CIP project, having IT in the room when we're just talking about building a building, there's electronics in there, there's going to be technology. Coming together at the same time is really, really important for the department heads. Got O&B, again, the greatest people in this discussion. So we're going to ensure compliance. We're going to make sure that we're hitting all the milestones when we need to. We're making sure that we adopt everything in the right order, the right fashion, that we are keeping the train on the tracks as far as getting your budget adopted. We're going to do some analysis, making sure everything ticks and ties and makes sense. And then we're going to prepare all those reports and presentations that you guys will get throughout the process. Again, if you want to see something, let us know. We can make it happen. And good news, if you completely tuned me out, there is a page from our award-winning budget book that kind of goes over the budget process. Way less detail, but it's enough to remind you of where you just tuned me out.
Your quiz?
No quiz. All right. Any questions?
No, I love the straightforward.
So you're saying if you see something, say something. Is that what you're saying?
Yes. Mm-hmm.
Okay.
So I did ask for this item because I'm in DOGE mode right now, as I think half the rest of the world is. And I wanted to hear you and how you interact with the department heads. I too believe that at the service level is where the best decisions are made. Those are the folks that are out that should be looking for best practice. They're the folks that should be looking at justification of a staff, new staff, no staff. Do you, or and this could be both of your answers to this, but I'm used to having a rollback budget, and then I have we would like to have budget. Have you ever started at rollback, or do you have a rollback figure in your mind?
Gotcha. So based on the board's direction, and we've been getting it for most of the years that I've been here, you guys said flat or reduced. So we're not starting off at rollback, but we definitely keep that number in mind. We have to say it during our public hearing, so it's always there. If the direction of the board was to shoot for rollback, then that's where we would start. And Heidi, if you want to add anything to that.
We typically get our guidance from the board. That's why we start in December to kind of see what the pleasure of the board is. And as Brian has said, historically, it's always been either a flat or reduced millage is what we aim towards. When we look at just the cost of living of what we've seen historically, just to keep up with not just the CPI, but some of the different contract costs that we have, we're looking at probably somewhere between what's required is probably like a 4 to 5% increase over the previous year, just to keep pace with what we're currently providing. If we were to start with, say, a 10% reduction, we'd be talking about shutting programs down or eliminating staff. We just don't have that kind of flexibility within there. So,
Well, I don't have a problem with shutting stuff down that's not efficient or that's not needed. Again, if you're looking at that during your process, then it should be coming forward so that we can make the decision whether or not it stays a project or not. I had another question. Oh, the history, I know that routinely you all don't put history in your reports during the budget process, and I know I can come to you at any time and ask for a history report. But one of the guidelines I use is, did they use the whole amount last year? I don't know how you prove that to us, or maybe you don't. Maybe you just start with another number, with the bottom number. But historically, if we're at 75% of the year, and the budget should be running at 75%. So if you're off by 25%, then there's something different, or there's something that you can respond to, but it doesn't necessarily mean you don't need it. It just might mean that it's a seasonal or timing thing, so.
Yeah, so when you guys get budget pages from us, it has 2 years of historical data,
Okay.
the current year budget, and then whatever budget we're talking about in that moment, so tentative or the
Right.
future adopted. The other kind of hard part to see when you look at year-to-date budget reports, so if I know what my purchase order for a particular service is going to be, I should be encumbering it day one. That way I don't accidentally spend it on something else. So I might encumber 100% of one line item on October 1st, but it doesn't mean I spend it all on day one.
Okay.
So that would be misleading when looking at an available budget standpoint, but
Okay.
different columns on the report would tell you that information.
And then what about your projected, Pam can probably speak to this better than me, but personally, I think we're looking at a flat. I don't think we're going to see a lot of property tax increase this year. I don't know about Pam, but real estate's a little tough right now. So do you take a stab at what you could potentially get for added revenue through ad valorem, or do you just wait until July until your clerk of courts gives you the number, the appraiser gives you the number?
So we will throw around numbers every year that I've been here, we always start at a very conservative 5%.
Okay.
And then kind of see, okay, so say the property appraiser gives us a little, bit of information like, oh, things are looking good. Then we might bump it up a little bit, but we're not expecting the large increases that we've seen in the last couple
I
of years.
wouldn't if I were you.
Yeah.
I would say that the last time our market tumbled was '07, mid '07, and tax values went below half. We lost 50 years of income at some places. That's not happening this time around, but what happens is the tax rolls, from what I've seen, and Jay Gardner, our tax appraiser, may be able to add to that, we don't see that until the year and a half later.
Correct.
So if you've been around long enough, you know that when things depreciate, and we've depreciated over the last year and a half, a huge percentage of what we had in values, those taxes are going to be reflected not in 2025, but in 2026. And that's when they'll start coming down, so we'll have less funds then. Right now, we're okay, but next year, we're not going to be okay on the same thing we're at today, unless more people are paying taxes, in my opinion.
And I think what we see is the new construction. That's really what's been helping, I think, carry local government's budgets. And I know that, there's a lot of comments out in the community that they don't want the growth. But we don't have the commercial and industrial tax base. We are heavy on residential. And we would die if we did not have growth. And so if we didn't have new construction, that's actually what keeps us going. Because when you look at the property rights, your homestead exemption, and the fact that you can only go up in 3% in value, and then they offer a slew of additional exemptions on top of it, that's not where we're making the money, because as I said, we need like 4 or 5% just to keep up, and you're capped at 3 on your property. So it is the new construction that happens, that comes into our community, that keeps us all alive.
As long as people stay in their homes, because then you get into the foreclosures and short sales, and they're not paying taxes. And then you're behind the scene again, because that's what's happened before. And sometimes you see a page this long in the newspaper, and when they start selling tax deeds, and thank goodness for tax deeds to keep us solvent at all. But there will come a time when people can't afford it, depending on what happens.
Yep.
In the next year or two will be a big chunk of a change that people may not be aware that's coming. Doesn't mean it's going to be bad. It might even out. But we have to shoot for the lowest point and be happy if we can get above that. In my head, I always try to plan for the least possible, so I have a
So I just got a new builder, sent me a text, $5,000 bonus on top of 3% commission. So it's not pretty out there.
$20,000 for
It's not
closing
pretty.
costs to the buyer and doing what they can to try to sell their product. But there's no end users, then there's no new sales. And they're just sitting on the property at agricultural cost. So I wouldn't necessarily count it always as coming in this year or next year. It may take some time to recover from it.
And staff does a good job of that, looking at some of those economic trends and where do we, they do that when they forecast the budget as far as looking at revenues, looking at expenditures, or looking at all of those trends and changes. So they do a good job with that.
Any more questions for Brian? No?
Brian, if we do have a question about a specific program or project or something, we can come one-on-one, right? We don't need to bring it up here, ask the whole board if we can come see you and.
Yeah, anytime.
Okay.
All right, thank you, sir.
Thank you.
Appreciate it. All right, comprehensive plan discussion, transportation and coastal management. Good afternoon.
Good afternoon, Commissioners. Simone Kenny, Planner. This is our second workshop in a series going over our comprehensive plan update. Today we're talking about transportation and the coastal management elements. Again, I'm going to very briefly go over the plan update overview, briefly summarize public input, and then get into the element updates. So very quickly, our comprehensive plan is really our guiding document for the future plan of the county. It helps residents identify their vision for the future, and it helps coordinate local decision-making. And I just want to reiterate that all of the information related to the comprehensive plan update can be found on our project website, which is tinyurl.com/Flagler2050. Right now, we are working through these various workshops for the different elements. That should take us through April. And then between April and May, hopefully we'll have our transmittal hearings. Then the state reviews, sends comments back, and we have 180 days to adopt and publish the plan. That should put us sometime in summer of this year. Through our various public engagement that we had, helped form our 2050 Community Vision Statement, which is the overarching guiding principle for how we update the plan. And it states that in the year 2050, Flagler County will represent the best Florida has to offer: scenic waterfronts, working farmlands, and charming rural communities preserved through the strategic cultivation and growth of walkable and vibrant neighborhoods served by resilient and sustainable infrastructure. And then that is broken down more specifically into our 11 vision directives, which is increasing resiliency against natural disasters, improving ongoing drainage systems, diversifying local industry and employment opportunities, concentrating future growth to existing urban areas, cultivating a more affordable and diverse housing market, ensuring a sufficient and clean water supply, conserving the natural environment, maintaining and improving public facilities and services, supporting working agricultural operations and industries, establishing a connected and safe bicycle, sidewalk, and trail network, and finally preserving the charm and character of our rural communities. And these vision directives, again, through our public engagement, we identified specific strategies to implement these then into the comprehensive plan elements that we updated. So moving on to the transportation element, the purpose of the element is to plan for future transportation enhancements and improve the mobility of goods and services while enhancing quality of life for residents, primarily through roadways, transit facilities, bicycle and pedestrian facilities, as well as airport and railroad facilities. The related vision directive that we got from the public was primarily to establish a connected and safe bicycle, sidewalk, and trail network through creating a priority list of connections for the network, ensuring that trails connect with green spaces and recreational spaces throughout the county, including the Florida Wildlife Corridor, and taking a look at complete streets design with a focus on bicycle and pedestrian facilities. This helped form our overarching goal, Goal B1, which is to provide a safe, convenient, and efficient multimodal transportation system that is coordinated with the desired future land use pattern, protects natural resources, and maintains adequate capacity to meet demand projected through the planning horizon of 2050. This element is one of the largest that we have in the comprehensive plan, so there's 17 total objectives. I'm not sure if it's in the best interest to read through each and every one, so I'm going to pick out the couple that I highlighted. For example, objective B17, the county would study and recommend transportation system management improvements and travel demand management measures in order to increase roadway capacity, reduce peak hour congestion, and improve roadway safeties. These are sort of low-cost initiatives that we can take to try to help relieve some of the congestion on our roadways. That can look at straightening a roadway, redesigning corners, perhaps widening a merging lane, just small scale and specific initiatives that we can take. And then objective B 1.10, Flagler County will promote the use of bicycles and walking by providing adequate facilities for pedestrian and bicyclists. And then objective B 1.11, Flagler County will evaluate the need for future fixed route transit service and update its transit development plan to document public transportation services that will be economically feasible and implemented when there is a demand for the services and the county qualifies for the federal transit funds. So we do have our transit development plan that goes through a small update every year and then a much larger update, I believe, every 4 years, and that'll be coming up next year. So really, we just want to keep an eye on what the demand is. Will it be coming in the future? Because there are several steps and initiatives that we would have to take before implementing a fixed route. From the very beginning, we would have to look at potentially right-of-way acquisition, bus stop infrastructure, things like that. So we just want to stay ahead of the game on that. And then objective B 1.17, the county will coordinate with the Volusia Flagler TPO to promote a safe, efficient, and resilient multimodal transportation system. Again, this past year, the entirety of Flagler County was included in the TPO's boundaries. So we will be working much more closely with them on plans for the whole county.
Can I take you back to the start of this chapter? In one of the diagrams, it was table TE-2. Can you pull that up? You haven't shown it to us yet, so I just.
I don't believe I have it in the PowerPoint, but
Okay, well, let me ask you a question, and then I'll get with you. I don't understand the number of lanes per direction that are listed in there, and why we're going from the current LOS of C to adopted LOS of D. You don't show anywhere that much of an increase in traffic. You don't show any increase in traffic. So just curious, those two questions. What is the number of lanes per direction? That doesn't make any sense to me. And then why are we going from C to D on the LOSs? And I'll get with you.
all right, I can answer that for the level of service. We are proposing a drop for our principal arterials in the county. That's I-95 from a C to a D in the urbanized area and a B to a C in the rural areas. This is because that's FDOT's standard, and they're the primary jurisdiction and funding over that area.
Okay. Okay, then, so just I need to know about this number of lanes.
All right, I will look into that.
Okay, thank you.
May I ask also, the use of the word multimodal came up a couple times when we had our airport discussion earlier. Can you lead me to where I can find more information on multimodal? It's a buzzword, it's a phrase, what are we talking about?
Sure, I can
Air, train, car,
provide
bus,
some resources
all
for
of the
you.
above?
Pretty much. You have individual occupancy vehicles. It can also include ride shares. It can include what we call first and last mile, which are primarily the scooters. Include the bus routes, really just the many different forms of transportation that are out there. But I can provide some more
Right, but that's
resources on
fine.
that as well.
So it's what I thought it was.
It's a very
okay.
broad, general term.
Okay.
On that objective, you wrote down, it's not this one. Yes, thank you. Public transportation. In the city of Palm Coast, we have a handful of throughways and a couple of loop lanes that branch off. It was not designed for public transportation. Since it's such a large parcel of land for us to, I guess I don't know if it's our problem, city's problem, or both problems. We have main roads, we have state roads, and we have internet and national roads. How do we put all that together? Is it just about the exterior of Flagler County, period, or is it including the city of Palm Coast, where there is very few straight streets and loops and loops and loops?
I would say that really gets determined by the transit development plan, where we have our consultants and experts and feedback from the public on what would best suit. I think the very, very broad general plan that's in there now is potentially a fixed route from Bunnell to Flagler Beach, and then potentially just one route from State Road 100 up to Matanzas Woods, just one across and one up and down. The intent with that is just really helping people get access to the very basic services, even if it is just to the grocery store and home. Right now, with our transportation disadvantaged, it does help a lot of the people in the rural part of the community, but again, you do need to make an appointment. That can be challenging sometimes. Primarily, it's used for medical appointments, but if somebody could get on a singular line, get to Publix or Target, and then get back, that would be a big improvement.
We did have a serious issue with the Jutneys, with the elderly needing to go to their doctor appointments, waiting 2 hours to get one. I heard that years ago. It's still going on, so I don't know how we have public transportation that's affordable, but the time constraints because of the congestion and that's before all the growth.
Pam, we had about 4 years ago, maybe it was 6 years ago, it's running together, we had a very thorough study done of bus routes and what could we do and what couldn't we do. And they're the ones that said what she just said. We can do those 2 straight line ones. But Palm Coast, unfortunately, was set up really badly so that, and they always justify bus routes by the first mile and the last mile. How are you going to get to the bus stop and how are you going to get home from the bus stop? And Palm Coast is set up very poorly for that. I mean, you could run a bus down Hemington's Parkway, and there's no homes on Hemington's Parkway, but once you get them into the neighborhoods, then they can't do it. They just can't do it. So that was I don't know how many thousands of dollars we paid for that, but that was their solution was what she just said. The only thing you can do is we got couple straight line ones that you could do. But again, it's the first mile and the last mile, how you get to the bus and how you get home from the bus. Yeah. Yeah. Well, yeah.
Yeah. Right. Absolutely. And so then I just wanted to highlight some of the major policy changes. The first one, B 1.2.3, the county will implement a program to collect traffic counts on an annual basis and monitor roadway level of service. This one's pretty important because as it stands right now, we don't have a method for calculating road counts. You will see them in your data and analysis. That data has been extrapolated by the transportation engineer from our consultants using FDOT's data and Palm Coast traffic counts. So really to have more accuracy and to have a quicker understanding of how the capacity in our roadways are changing, we do need to implement our own method of calculating those traffic counts. Yes.
Palm Coast does theirs every 2 years, if I remember correctly. Do we need annual counts in the rural? And is there opportunities? I think if we piggybacked on their every 2 year service, we could potentially utilize the same consultants that they're using to level to at least measure the rural roads or the county roads.
Yeah, that.
Some county roads aren't so rural anymore.
Yeah. That's a very reasonable point to make. We can make that change. And then policy 1.3.4, the county will continue and to provide and potentially expand its demand response, at least in the meantime. door-to-door service with the Flagler County Public Transportation. Then the county will participate in discussions with regional partners on potential establishment of commuter rail and potentially connecting to Sudden Rail or Brightline. This is a very long-term goal. Really, it just means that, we'll keep an eye on things, we'll participate in conversations, but we, in the worst case, don't want these conversations to be had without us.
Right.
And potentially be skipped over, even if it is, decades in the future. And then the county shall implement complete streets design methods in new surfacing and widening of roadway facilities to accommodate multiple modes based on the appropriate context. Complete streets is a design method that really puts a lot of emphasis on pedestrian safety as well as distance from edge of pavement to the sidewalk, whether or not some protections are needed in between the roadways and the sidewalks themselves. And I believe there is a diagram in the data analysis as well.
So when I first got it, I searched to make sure at least that the terminology was put in there. I think the important part is taking it to the next step. It's great to have it as a policy statement. We've got to start implementing.
Yeah.
And because there's too many missed opportunities. But we have to start at least diversifying, getting people, if it's viable, getting them out of their vehicles. But okay, good deal.
And then the county shall evaluate opportunities for innovative transportation technologies, solutions to be advanced in new developments or along existing corridors, such as micromobility, intelligent transfer systems, vertiports. Again, this is more of a long-term policy, just ensuring that staff will, and the county itself will remain up to date on these new and emerging technologies. And then the county will promote walking and bicycling trips for non-recreational purposes through the development of a regional trail system throughout the county with a particular focus on connecting trip generators and developing a highly connected trail network. So these specific developments that do result in many trips, like our big box store parcels, making sure that they're connected to the trail system or sidewalk system as well.
It helps if we mandate at least bike racks on the developments, because that's again, the Palm Coast has it as a mandate, and it's we have to become a little bit more tied with a lot of there's some good things that they've got in their LDC that hopefully we can, with new policies or modified policies, we can translate back to the LDC.
Yeah, and again, we do need to have a complete overhaul of the LDC after the comp plan is adopted. Again, several of these policies state that the county will work with the Volusia Flagler TPO, that's our transportation planning organization, on improving our streets, following up with the complete streets designs, and then the county, we have a policy here of if the county should develop an airport overlay in the land development regulations that provides measures for mitigating impacts from sound obstructions and other airport-related functions. That would be potentially different than the airport ordinance that has been presented before you over the last couple of weeks. This one would be more specific to land use, property use, rather than just building height. And then the county would coordinate with the City of Palm Coast to develop an economic development strategy for lands surrounding the airport, because again, this is our largest cluster of industrial lands, and based on the budget presentation that you just heard, we really do need to grow our industrial tax base and revenue.
So this was one of the questions I had on my review. And that is, Is not the land directly around the airport belong to the county, or is it in Palm Coast and the county? Is it split?
It's split, but we're
Yeah.
losing more and more of it.
Yeah, the city owns most of the land, not us.
No. I'm sorry, can you say?
Around the airport is
The
the question.
developable land around the airport belongs to Palm Coast or is in Palm Coast?
Is in Palm Coast. The county property that's owned is the only unincorporated area.
And that's what's being annexed?
No, it's the airport and the
Right.
property that we own. That's the
Around
only
it.
unincorporated Flagler. Everything around it belongs in the city of Palm Coast.
Well, we had some. BJ's was annexed in, and now the last remaining parcel is being annexed in.
Correct.
So we did have some. And across the street from Target? Is that still unincorporated? Okay.
I think it still
So
is.
there's very little, and it's,
Right, so
it-
that's
we're
my
losing
question,
it.
why? I mean, like, I know it's not a high priority, it's a policy, but I didn't see a whole lot of land around there that, I mean, it's industrial, so it's going to be an economic development, right? If it's industrial, it should fit in the economic development strategy, but that's fine. I just don't see, I don't see us impacting what Palm Coast does, but I could be wrong. And the other question I had was, page 95, excuse me one second. It's too late, darn it. There is a policy, I didn't write the number down, to allow jet services at the airport. I thought we did allow jet services at the airport.
You currently have charter jets and things like that. I don't know what the reference is here. It would never be a commercial airport.
Page 95. One second, just let me get to page 95.
Yeah, we have jets come in for that rehab.
I can't find it. Go ahead and go on, and I'll come back to it.
Oh, I see it. Okay, so I believe when we were drafting this element, we were going based off of the current Flagler County Airport Master Plan. But then understanding in the past few weeks that the master plan is to be updated, and the goals to be changed specifically with that one runway. Is it the extra long runway that's going away, right?
You have the ability to expand one of the runways by 1,000 feet, so either end would be expanded 500 if they chose to do that. But I think what Sean was referencing was the ability to expand the airport to allow for jet service. You'd be restricted by the length of the runway. I think it can only go to, Roy's not here, I think it can only go to 6,500. I know this is something that we had talked about when we were meeting with one of the economic development partners that we were trying to entice to come here, the French aircraft manufacturer. If they came here, it would have required us to expand that 1,000 feet for their type of aircraft.
It's not real, I can't find it, but it's not real specific upon the size of the jet or whatever. It just says that we need to allow jet service. You might want to find it somewhere in back, but we already do that. So I don't know why it's stayed in there, but
Again, if the board has direction about a specific policy, we can meet to discuss that as well. All right, any questions about the transportation element?
So there's discussion on one of these policies about the impact fee funds. And I think we're going to need that as we move forward towards an annexation discussion. But I think you're going to find it in there on page, oh, see, you guys have got a different view than I have. The pavement management program, just an FYI, Flagler Beach subscribed to a program where you drive all the streets with a camera. You send the camera or the video into this company, and they bring it back with a map of all the streets, and they're able to identify and prioritize what projects they're going to do, and then they publish it so that people know when their roads are going to get dealt with. I didn't write down the name of the company. I did sit through the presentation, but it would help us, I think, prioritize some of this resurfacing of some of our streets.
So we currently do something very similar.
Oh, you do?
Yeah.
Okay,
So
great.
we typically do the outside company assessment I think it's every 3 years. Internally, we'll manage it by doing visual inspections or dashboard, you're driving around. But we do have it mapped out. And the other change that we implemented with working with FDOT on our 5-year plan or long-term plan was previous engineer hadn't really created a structure or a metric of determining when those roads should be done. So now with the engineering team that we have in place, they've really looked at that and created different kind of like benchmarking criteria when we look at what type of road it is and how many residential connections, or there's a bunch of different criteria that go into it. And I think it's, I don't know if I remember exactly, if it's 7 or 8 different criteria that kind of come up with a score, and then that determines the priority list. So it's managed internally with engineering, but we do use an outside consultant like a pavement management company as well as internal.
Okay, thank you.
All right, on to our coastal management element. The purpose of this element is to understand and plan for the protection of natural resources, properties, infrastructure, and human life against the impacts of sea level rise, storm surge, and other flood-related issues associated with coastal living. And again, the related vision directives we got from our public engagement process was to increase resiliency against natural disasters, doing so through updating our goals, objectives, and policies in this element to emphasize resiliency, by ensuring consistency with the vulnerability assessment and compound flooding study. That should be presented to you all, I believe, starting in June. We'll start having public engagement workshops related to that. These are our 2 studies that are being spearheaded through the Northeast Florida Regional Council. And then coastal hardening in areas that have experienced significant erosion. And for this element, we have 2 goals. The first is that the county shall preserve, protect, and enhance the natural and historic resources of the coastal management area as development occurs and increase resiliency against sea level rise and storm surge. And the second goal, which is that the county shall increase resiliency and protect people and property from the effects of natural coastal hazards. This element is also pretty sizable and has 12 different objectives. So just highlighting the ones that we saw come up in the public engagement process the most. We have objective CME 1.3, which states the county shall protect, conserve, or enhance coastal wetlands, living marine resources, and coastal barriers, and continue to maintain the water quality of the interlagoonal system, that's the intercoastal waterway, as good or better as classified per the FDEP standards. And then another important objective that came up was objective CME 2.1, that the Flagler County shall reduce or maintain hurricane evacuation times for areas east of the intercoastal waterway, meaning the whole barrier island, in accordance with the times designated by the Florida Division of Emergency Management in their most current hurricane evacuation study. So just highlighting the big policy changes, the first of which that the county shall require development proposals within the coastal area, again, that's on the barrier island, to preserve at least 10% of the native vegetation, defined as plant species naturally occurring within the coastal ecosystems of Flagler County, such as those identified by the Florida Natural Area Inventory, and that those development proposals which cannot preserve at least 10% of the native vegetation on the site shall submit a mitigation plan with the site plan. Mitigation can take several forms, including but not limited to creation of a new habitat of the same type destroyed, or restoration of previously disturbed areas, and habitat purchase for the purpose of preservation.
Andy, how does that tie in with your tree ordinance? Does that fit?
If I remember correctly, the tree ordinance had 15%, but it didn't specifically say native vegetation. Could have been open space, so
Yeah.
we'll have to just compare to make sure. But we were talking LDC versus.
Right, that's the next
Yeah,
step. Yeah,
but,
next step, yeah.
I think there's room to make it,
Make that work?
yeah.
Okay.
And policy CME 1.4.3, the county shall continue to require beachfront developments dedicate a coastal easement to the county for beach renourishment purposes. The county shall require new beachfront development to show on their site plans existing beach access ways, and on the proposed development shall continue the access way. They must relocate it on site or donate it to the county. And any relocated access points must be similar in character and convenience to the original. Again, this is to attain that goal that's in our parks and recreation open space of obtaining a beach access every half mile. Policy CME 2.1.1, the county shall not approve any increases in hotel or motel beds or residential densities in the area east of the intercoastal waterway. Again, that's the barrier island. That would increase evacuation times above the adopted base scenario level E, out of county evacuation clearance times. Yeah.
So do we have for the barrier island, we've got 2 bridges and a north and a south exit for evacuation. Do we know what the maximum density of the barrier island would be to trip the clearance time? At some point, you'll hit that one density that trips the clearance time. And do we know what that is?
Not off the top of my head. That will be in our our emergency management
Yeah,
comprehensive plan.
Jonathan's been asked that question over in the hammock, and he says, "Don't worry about it.
We'll never get there?
We'll never get there." He's got a book, it's that thick, that shows you population of the island, when to start
I
evacuating.
remember that conversation, but I
Yeah.
didn't know if there was a metric.
Yeah,
Because otherwise, why even have that policy in there if it's not going to be met? I mean, I would think at some point
you would.
there would be
Yeah. Some
a
number.
level.
Yeah, that was a tipping point.
Right.
But he said, we'll never get there.
Okay.
There's not enough room out there to put enough people to trigger it. So,
Okay.
I don't know, because Flagler Beach barely hits it. I believe there's only one bridge off unless you go all the way down to High Bridge to get off in Flagler Beach
In your city limits.
in the city limits. And
But you've got
that's a good
High Bridge
question.
is out of county.
Yeah,
Dunes Bridge is in county.
so we only have one way off, and
Dunes.
I don't know that we make it.
Dunes.
by
Well,
boat.
sure, if you want to go north. I don't see how you can do this, that you shall not approve any increases in hotels or motel beds and residential densities. Those are your short-term rentals, right?
Right.
In the areas east of the intercoastal, that would increase evacuation time. You better figure out what your above adopted base scenario level E is if you want to try to enforce that.
Right. I think that was the point.
Yeah, I think that's your
Yeah,
point.
That's probably not enforceable, and there's some
It's
odd,
not.
odd words in there too that need to be taken
That's
out.
not a
But-
good policy.
But I think that one probably needs to go. I mean, I don't think we can do anything about it. I'm sorry, sir, you can't build your house on your land that you own. No,
Well, current
I
platted
don't think so.
lots that are buildable, they are vested. This is more so in relation to somebody who came in, maybe they wanted to increase the future land use density or intensities, or they wanted to do a bigger development. There are a couple pieces of property up there that are undeveloped. And then if the future land use was to be changed, could result in a much higher density than there is now. That's really what it's referring to. But we can meet with Jonathan again and rework the language in this policy a bit.
Is there a map of the coastal high hazard area on our website? It's not I was on the property appraisers, it's not one of the functions to identify on the property appraisers map, but do we have that on our county website? Is it a GIS map?
I don't believe it's on our county website right now. That's partially was completed by our consultants for this comprehensive plan update.
Okay, but not all the barrier island is coastal high hazard.
That's correct.
Okay.
And so that leads into policy 2.2.22.
FSAR is ahead.
That the county should limit public funding for new facilities within this coastal high hazard area. Limit it to public access to the beaches, resource restoration, fire, public safety, and passive recreation facilities, meaning that the county shouldn't be necessarily spending public funds on public facilities knowing that they're in a coastal high hazard area.
Well, we do that, though. We build walkovers and
Right, so that would be
Restrooms.
exempted as the public access.
yeah, okay.
And then moving on, the county shall continue coordinating resiliency efforts with the Northeast Florida Regional Council and implementing the recommendations of the vulnerability assessment and compound flooding study. Again, you'll start seeing workshops on those studies, I believe, come June. And then the county shall encourage existing hospitals, although I don't believe we have any, congregate living facilities for persons with special needs, nursing homes, and the like from within the coastal high hazard area and FEMA special flood hazard areas to relocate to safer locations within the county. And then areas needing redevelopment shall be evaluated by the county in a review process for appropriate land uses, eliminating unsafe conditions and restoring coastal resources. The redevelopment activities that would result in an increase in hurricane evacuation times or shelter demand should not be approved without mitigation of the adverse impact as approved by the county's emergency management director and growth management director. So this one kind of ties in again with that policy 2.1.1, sort of thinking about absolute worst case scenario if there is an area that is severely damaged by a storm and needs total redevelopment, that it wouldn't be redeveloped in a way, again, that increases those evacuation times and would be approved by the county, the emergency management director and the growth management director. Any overarching questions on the coastal management element at this time?
You mentioned the regional council's study, a vulnerability assessment and compound flooding study. Is that finalized yet? Have they published that yet?
So you will start to see workshops on that come June.
Okay.
And I believe their completion date would be sometime in December of
Are
this
you
year.
bringing that to the planning board as well?
We can
Or
at
at least alert them
direction of
of
the
it,
board,
yeah.
yeah. I know the Northeast Florida Regional Council is planning on having much wider public workshops,
Okay,
not
good.
just within the county, but Palm Coast, because it does affect the other municipalities as well.
Right.
But we can bring it to the planning board as well. All right, so again, next steps. We have at this point, I believe, 2 more workshops. At the next workshop, you'll be receiving economic development, housing, and capital improvements. And then we are trying to reserve a complete separate workshop for just the future land use element, because that one is by far the largest and arguably most important in the comp plan. So we're planning to get through with those by April, and then starting April to May, having those transmittal hearings, submit to the state. Again, they review, they send it back with comments, and then we have 180 days to incorporate those comments and adopt. So hopefully sometime this summer, and then following that, starting in the fall with our land development code rewrite.
Okay, great. Commissioner
Yeah,
Hanson.
were you going to go, you left out a section, section 3?
That one is in the data and analysis portion of the comprehensive plan. I did receive a question about that this morning. So we did the data analysis as one of the first steps in this process, meaning these drafts were done by the end of 2023, and then I believe the Emergency Management Division updated their comprehensive plan in 2024, so we have to go back and re-update this to incorporate the changes that the Emergency Management
Yeah, because the
Division made.
evacuation zones are wrong.
Yeah, yeah.
And he said he sent something to you to fix that.
Yeah, we will update that to make it compliant with the new one.
Ms. Simone, can I verify that you received this email from today at 6 a.m. from Mr. Dennis Clark, Chairman, Scenic A1A Pride? Mm-hmm. You did?
Yeah, we did. Those comments are based on an older draft that I believe we sent to them in November or December. So some of them need to be updated. So we'll resend out after these workshops the newer versions.
Yeah, we've been
with
working on that
incorporated.
one for a couple months.
Mm-hmm.
And that's how he got the design. I sit on that. That's how he got all that stuff to send to you.
Mm-hmm.
Yeah.
And we will incorporate those
So we're
comments.
going to we're going to incorporate it and stay in touch with him, correct?
Yes.
Thank you.
All right, thank you.
Very good, thank you. All righty, Ms. Petito, any other items for discussion?
Yeah,
I don't
let's
have
think of
anything.
something.
Excuse me, I don't have anything, sir.
Are you sure?
Sure.
We have the rest of the day.
Yeah. It's only 4:19.
Yeah, we have another meeting, I think, after
You
this.
do, you probably need to get ready for that meeting. Public comment, is there anybody here that wishes to address the commission on any of the workshop items today? I was going to be shocked if you didn't come say something, as long as you've been sitting there.
How you doing? My name is Raymond Royer. I'm from Painters Hill section. The only problem I have is the republishing program that you're trying to develop and doing a taxation on it. From Painters Hill section of the North unincorporated section, we oppose the taxation only because we had to go for that Painters Hill wall section, and those beach homes end up paying. I think they pay had to pay like over $1,500 per linear feet to put that wall in, and I think it's a 15-year loan that they're paying on that, and then you're going to put a linear tax to put replenishing sand. I don't understand why we're replenishing sand when we have these walls. Also, I oppose the program that you're developing because you're not putting any walls up. You're not continuing to put seawalls up, and we need the seawalls. I mean, to put sand up. A couple of you made comments. I mean, I think the public's correct that we're throwing a cent out of it, but one storm, and I have a storm, it'll cost us millions washed away, and in one day. And so I think if he's, I talk to the public a lot. I'm a very open person, and even like, somebody mentioned, I think it was you, Greg, that, people say, I don't use the beach. Well, there is a lot of people that don't use the beach. And the reason for that, because Flagler's Beach City doesn't provide enough public access to the beach. They only have that one section downtown. And then you're going to put a taxation, and then the whole north side and some of the south side where there's no housing doesn't have access to park to use the facility. So you're going to tax Palm Coast, you're going to tax Benel. Those people want to come in and use the beach, and there's no place to park because over the weekends it's crowded down there. I mean, there's no place to park, and that's the problem. I think people are getting frustrated because I think everybody wants to try to save the beach. Everybody understands that part, but you're not implementing a bigger plan to bring everybody as community-wise, to see where the money is really being fairly distributed fairly. And like I said, well, I'm from Painters Hill, and you know how that went. I mean, the people on the beach home, they end up paying the foot of the bill. But and again, I seen the gentleman here last. I've been watching your meetings lately. There was a gentleman here in the meeting, on the replenishing, and he wanted to know why he can't put his own seawall in. And then I talked to this other gentleman that's going to spend close to, $500,000 to put his own seawall in, and you guys aren't contributing anything. It's his cost, and then he's got to do all this, planning and stuff. He has to put the seawall parallel to his property because he's the only one putting one in, and he's come to use and asked, hey, can you get the other neighbors to help me out so we can put a community wall up? And you just didn't help him. So I think you guys are not looking at the bigger picture, and that's about it. That's all I have to say. It was a long day.
Thank you.
Thank you.
Yeah, go right ahead. Commissioner Hanson, you have a comment on that?
Yeah, a couple of things. Let's talk about the seawalls first. The gentleman that wanted to put a seawall in and couldn't, that was because he didn't have a house on the property. You got to have a house on the property, and then you can get a permit to get the seawall. As far as one house, the 15 houses that went together, and we paid for the seawall, and then we charged them
Correct.
in there.
Correct. I got the paperwork on it.
Yeah,
Yeah,
that's one group. Then north of there, there were 3 groups of houses that on their own, did it on their own, contracted out and built the seawalls.
Yeah.
But you have one misconception. The seawalls work fine as long as you put sand in front of them.
Yeah.
If you don't replenish the beach in front of them, then you're going to have trouble over time. And there's a good example. If you just go just shy of the Matanzas Bridge, just go over to the beach and look south. And you'll see where there's a beautiful beach, and then 4 homes put in a seawall, no beach. And then just past them, beautiful beach again. So it's a combination of the two that works. And the seawalls are so expensive.
They are expensive.
So expensive.
And
that they're just not, they don't, we, as much as Ms. Petito has put this together, factor in by 10 if we added seawalls. We can't afford the seawalls. And the beach plan or the designs that we have actually work, and they don't, all the sand doesn't go away.
Yeah.
The sand equilibrates out into the ocean, and then you've got a 10-to-1 ratio just by nature. It just makes it 10-to-1,
Yeah.
and that slows down the wave action so that it does not attack the beach, the dunes. So that's our goal, and that's the what we're trying to fund now for the whole 18 miles.
Right.
That's what we're trying to do.
Right, and you also got to take in evaluation of the areas that did have Plemish sand and got hit by an eye of a storm. The wall didn't do anything.
If we get a direct hit,
And I'm going to go ahead and
Exactly,
close- I'm gonna
and that's
close
what I'm
public
saying.
comment.
Yeah, close public
Thank you.
comment.
All right,
I'll talk
thank
to
you
you
very
later.
much. But I mean, there's some good, I would say, Ms. Petito?
Actually, to that point, we have a meeting tonight in Beverly Beach, so we're pulling this together to show them, because Beverly Beach does have a seawall. Just having a seawall alone doesn't protect you, because if you don't have that healthy beach in front of it, it could actually accelerate the sand loss. And like you can see in this picture, this is Atlantic Beach up in Jacksonville, and you can tell in the 70s how they had a seawall, but it was compromised, because if you don't have that beach, healthy beach in front of it, And then you can see over time where they've reverted from the 1970 picture to what it appears today, which is actually building back a beach, which is really the best benefit. So I think, case in point, I understand that it's very expensive to do, but it's not once you have a seawall, you're not done. And that's kind of the point of what we were going to share today with Beverly Beach when we go out there tonight. So you may not have to plenish as much, but it's taken into account when we looked at the engineered beach, what each increment or each reach, the characteristics of each piece is different to kind of come up with a holistic approach.
There you go. All right, good deal. Any other final comments from the commission? Okay.
Are we done?
Motion to adjourn.
I move we adjourn.
Adjourn. Thank you.